Excellent. So I'll just admit our one more that came in. I'll go back briefly. Okay. And welcome everybody. Again, my name is Nelda Reyes. I'll be your host today. I'm a principal and one of the partners of Avicultural Drivers doing this work. Now that we're all together and recording, I want to be a warm welcome to the people that just last joined us. We are here to work on the Early Childhood Workforce Barriers study. That's the bill 2991, and you're here as part of the key partner work group. Great appreciation for you all being here. Again, our objective is to generate and synthesize recommendations for this report. All of you have different perspectives, and those should help shape the future of policy and improvements to meet the needs of the workforce. We want to go over some agreements for discussion and add any things that you might want to see in here. Again, a reminder that this is a public meeting that will be recorded and we will be posted at the DELC's website as a requirement. We want to make sure that we feel respected, that we respect all voices and experiences, that there is equal participation. You will have a facilitator, so hopefully that will help as well. But if you can step, step up, step back as needed, respect all the differences. You have very different perspectives. I know you're part of the system, but really they're doing work in many different areas and also from direct work with families and
Nelda, we just lost your audio.
no.
I don't
No.
think Nelda can hear us either.
No.
Sergio, can you get a message to her? Hang tight, everyone, while we get Nelda's audio back. Thanks for your patience.
Seems like Abigail has a question.
I'm just trying to see if I can cue sin Nelda, que no la podemos oír.
Oh, okay, yeah. We still can.
Nelda, we lost your audio after the first couple of agreements. Thank you, everyone, for the team effort in getting her attention.
Changing. Yes. Thank you. I don't know that how that happened. Appreciate it. Thank you so much. Okay, so I talked about equal participation. Um, I was going into respecting the differences, just mentioning that all of you have different ways that relate to the system, from just so you know a little bit of the composition of the different subgroups that will be your work groups. There are people that are going to be in the subgroup that are more direct service with families and the children. And there are other people that are more administrative, other people that might be working specifically on professional learning or career pathways. And so you all have very varied experiences and also some of you have gone like from being direct service to more administrative director. So just know that there will be very likely difference within your group, but we want to be able to capture some of those things. We did the best to group you in the topics of, we ask one or two priority topics. So at least you're in one of your priority topics. If we were able to make it work, you're in two priority groups. Most of you are. So just so you know, we did that. And the interruption flow really means that I'm keeping us all in the timing of the session. I might put a message for the facilitator or in the chat. I might jump into a session only to listen where you are and kind of keep all the groups moving today. Always let us know if you need anything, any logistical support. We want to, you to feel completely comfortable about asking to be, you know, um, if you need to leave the session, if you need to take a break, if you need to, stop the conversation because maybe it triggers something for you. So just do take care of yourself, and know that this is completely voluntary. You can step out at any time, and we want you to feel comfortable. So please let us know what we can do. Again, because this is a public meeting, we need to be recording. It will go into Delk's website once we're done with our work. So just know that. And we want, hopefully, to have a very productive conversation, a very, um, understanding space, a safe space. And yeah. So, is there anything that you want to discuss before getting started in regards to feeling comfortable in the conversation? I'll go over the agenda. Um, anything you want for agreements, anything else? Oh, okay. You can always let me know. We are now in the moment of, the introduction of the session. We will go ahead and go into facilitated work groups. Each work group has one topic to discuss. You each have one facilitator. Your facilitators will show the notes visually. They will be taking notes for you. You only have to focus in the discussion. You will have some time to add some thoughts at the end. You will do that for, about 80 minutes total. And then we'll come back to the larger group for final comments or questions. Your groups, again, were distributed based on your role, the work that you do, and your priority topics. Very briefly, just a quick introduction. We share with you the preliminary findings, which is the slide deck that hopefully was helpful to you to, get the whole context, those preliminary findings, have this introduction about what this bill is about. We really, um, the work that we're doing today, it really comes from this, the legislative session that happened during 2023. That's his Bill 2991, as you know, and it had to do with, examining inefficiencies in the system. Overall, I would say, like, one of the key pieces of this was examining like registry and, credit transfers, international accreditation pathways. But when working with our ESEC team members and DELC, there were other priorities also identified additionally for the research, which you probably saw in the findings. One of the key things for this work was that there was this work group that needed to be convened to do this work of putting recommendations together and thinking through collectively about a strategies. And And the intention of this bill is to build like a foundation for long-term collaboration. So we've had similar conversations in different settings in the early childhood field, and so it's really a strong commitment that they're presenting to us. So hopefully what we did today will really help into that effort. A reminder that the study design consisted of secondary research, primary research, uh, report on ongoing efforts, and we are on phase number 3, which is the analysis and recommendation development, which we are doing today. This is the key partner work group, which is part of the leadership in this project, which is you. And just a reminder that this will go into the recommendations that we start doing today will be drafted, where we will be circulating with you a summary of what was discussed today by Wednesday, so then you can add any thoughts. And then with that and with the work that we've been doing with the research, we'll put together some final recommendations for the report that it's going to talk in the legislative at the end of this year. Any questions about that?
Yeah, there's stuff that I have done. Keep you in the loop. Thank you. Yeah.
Okay. So you did some pre-work, and if not, don't worry. But we can adapt. Your facilitators will give you that. We're focusing. Just a reminder that we're focusing on questions number 3 to 6. Those questions that you received for your pre-work in the group what you will be in. Okay. So, any questions about what we're doing today? Anything that you want to add for agreements for safety? You could also add those more in your work group if you want to. You'll have time for that. Anything else? Logistically, anything we need to know before sending you? Okay. Oops. Excellent. Okay, so what we're gonna do is send you to your breakout rooms. I'm gonna open those for you. And if there's anybody that joined after this but made, I will put you in there, or yeah, thank you. So some of you need to join your group. So if you see a pop-up that says join, please click in there. You don't see yet. It's putting everybody. No, it's moving people. Oh, Um, Sergio, Viviana, can you join your groups? Are you seeing the message? No, not yet. Interesting. Paulina, can you help me out looking into?
Yes, I'm assigning them. I don't know why it wasn't automatically, but I'm doing that.
Ah, okay, that's why it's taking a while. Sorry, guys. Paulina assigned you before. Hola, Brandy. Good to see you. Help out. Mm,
Now, the people who are not assigned, I don't find them in the list, so I don't know if we should assign them manually.
Okay, let's just talk about this. So, Dana. Okay, I'm gonna start assigning people that I know.
Thank you for your patience.
Yeah. Solo Pau, no le muevas porque mientras yo asigne, porque si no, no puedo ver bien. Okay. Sorry, guys, we predetermined the groups based on the RSVPs that we got. So, and the priority topics. So I'm gonna assign you. Let me know if that's not a topic for you in the chat if you get into it, okay? Letty. Letty, what's your role?
Am- yo estoy proveyendo cuidado de niños en el condado de Clackamas. Apenas abrí
Okay,
una casa certificada de niños.
perfecto. Te va a mandar con Viviana, ¿ok?
Ok, gracias.
Gracias a ti. Okay. Está Katie. Katie. Oh, Katie, what's your role now?
I'm with Oregon Ask, we're the statewide after school network.
Okay. And what do you do?
We're an intermediary organization that provides like professional development. We do policy and advocacy work.
Okay.
Does that help?
Yeah, a lot. Thank you. I'm gonna send you to with Kim, okay?
Okay, thank you.
Yeah, no problem. Okay. Dana, are you interested in compensation or competencies? Compensation? Okay, I'll send you to Melissa, okay? Okay. Randy, good to see you. I'll send you to competencies if that's okay. Yeah? Okay. Kelly Sink, you tell me a little bit of your role.
Absolutely. I'm a research analyst at the Higher Education Coordinating Commission. So I think if you could send me to either career pathways or higher education, that would best fit my role. Thank you.
Good. Sure. Those are gonna be the in the afternoon.
Oh,
But
okay.
but right now we have compensation, competencies. Um, is there any of these two that are a priority?
I really don't have any knowledge in those areas. Would it be okay
Okay.
if I just came back this afternoon?
Yes, please.
Wonderful. I will be here.
Thank. Okay.
Thank you so
Thank you,
much.
Kelly. You're
Mm,
welcome. Bye bye.
Bye.
Jennifer, let's see. What do you do, Jennifer?
I'm a early childhood educator as well as a social worker, and I work at Portland State University in early childhood mental health field placement development. So
Okay. Great. Thank you for that. Super helpful. I'm gonna send you to with Viviana, okay? Thank you. Let's see, Carmen. Tell us a little bit of what you do, please.
Good morning.
Good
I
morning.
can see that when I picked my choices, they were both in the afternoon, my main interest, but I'm interested in all of these. I'm at work systems.
Mhm.
You can send me to either of this mornings. Honestly, I'm pretty
Okay.
invested
So
in either.
no problem. It's great. So I'll send you to compensation if that's okay.
That sounds great. Thanks, Nelda.
Okay, yeah, no problem. Okay. Jennifer, can you tell me, can you tell us? Oh,
I can't.
you don't,
I don't
you don't
see
see
a
the
thing.
box?
Mm-mm.
Okay, let me see. Oh,
It could be me. I just don't see anything.
no
Oh,
worries.
there it is. There it is.
Okay,
Thank you.
awesome. And Jessica, hello, how are you?
I'm good, thank you, Nelda. How are you?
Oh, fine, thank you. Thank you for the patience. I try to lead the people that know us more. Okay. So is it okay if we send you to compensation?
That's fine, yeah.
Yeah? Okay, thank you. I appreciate the flexibility.
Hi.
Okay, hi, Anami.
You don't need to put me in a room. I mean, I was just here to help support, and if you guys need anything else, like, let me know.
Yeah,
Yeah,
I
happy-
can, if you want and can't just say 78. I can put you with Kim. Might be helpful. Okay.
pasó ahí?
Okay, theoretically it's recording. I'm going to pick on you, Patrick, to start since you're next to me on the screen. Do you mind sharing your name and your pronouns if you'd like, your role in your organization, and then you can pass it to someone else on screen.
Sure. I'm Pat Aldrich, pronouns he, him. I'm the director of evaluation here at the Research Institute at Western Oregon University. I've been doing evaluation for 11, 12 years now. My tie to early childhood is we run 2 or 3 of the big state systems around early learning, and so I do a lot of the data and analysis and various aspects of that for those. So, good morning.
Good morning. Thank you for being here. Michaela, we're just starting to do a round of introductions. Patrick, do you want to pick someone to go next?
Sure. Since Autumn's right next to me on the screen, I'll choose Autumn.
I'm Autumn David. I'm a certified family and child care provider in Salem, and yeah, been doing it for 27 years.
Thanks, Autumn. Do you want to pick someone else to go?
Kim.
That's me.
So I was
like it though. No, it's all good.
Anna.
Good morning. It always feels a little vulnerable to pick someone. Hi, my name is Anna Howell. My pronouns are she and her. I am the training and education coordinator at Oregon Center for Career Development, OCCD, which is also houses ORO, the Oregon Registry Online. I am part of the leadership team and recently served as the interim director here, so I'm involved in a lot of things ORO related. Michaela, can I pass it to you?
Thank you.
Yeah, I'm Michaela Suckman at Oregon State University. I'm with the Oregon Child Care Research Partnership, part-time, as well as the Oregon Parenting Education Collaborative. On the childcare side, I do a lot of different research pieces, the workforce, looking at supply and as well as the market price, and a bunch of other different studies as well. So I was actually very involved in the analysis of the compensation as well. So I'm very happy to be here.
Glad to have you. Thank you. Do you want to pick someone to go next?
I see Katie just joined. We're just doing general introductions.
Hi, everyone. I am Katie Lakey. I'm the research manager at Oregon Ask, which is the statewide after-school network. So we're an intermediary organization. We do partnership development, professional development, and quality improvement, and policy and advocacy work.
Thanks for being here, Katie. And I'll pick on Nadira to go next if you don't mind, since Katie, you don't know who's gone yet and who hasn't.
Yes, hi, I'm Nadra. I'm the Federal Programs Administrator in the 4J School District. I also run the early learning programs in our district. Yeah, happy to meet all of you.
Thanks for being here. And I think that leaves Lizette. Do you mind coming off mute and introducing yourself?
Yeah, hi everyone. Nice to meet you all. My name is Lisette Arreola and I work at Capaces Leadership Institute. My program is Primeros Pasos, Early Childhood Education and Care, and I am the outreach coordinator.
Wonderful. Thank you all for being here. I really appreciate it. I'm going to pull up our notes document in just a moment. Everyone got to go, right? Yes. Yes. Okay. Before I do that, I'm wondering if everyone had a chance to review the materials that were sent by email, the deck, and I see some nods. That's wonderful. I'm going to invite you all to take about 10 minutes to revisit the section on compensation or to visit it if you haven't yet. That's okay. We know we're busy and you only had a limited amount of time with that material. So if you want to pull that up, I'll drop a link in the chat again, but the compensation section starts on, oh, of course, mine's not going to load. Hang on. Let me drop the link in the chat and then I will pull it up. And we can find the first page of compensation together.
I think it's page 14.
Thank you. It is page 14. I got there at the same time. I love it. So if you want to take about 10 minutes, you can go off camera. We'll come back together at 10:40 and start chatting about what we see there and what we think we should do about it. So thanks so much, everyone. Let's turn our recording back on. And I know Ami joined us while we were reviewing. And so I want to invite her in to introduce herself. Just let us know, Ami, your name and your pronouns if you'd like, and your connection to the work if you're able to. Give her a second.
So sorry, Kim. Can you repeat that one?
It's okay. I would love for you to introduce yourself since you joined us while we were reviewing things so folks know who you are. Do you want to just share your name and your pronouns if you'd like and your connection to the work?
Of course. Hi everyone. My name is Ami Goswami. I use she, her pronouns. I am a program associate at Fifth Element. Most of you, I think, probably got your invitations from me, just helping to help facilitate the work that we are doing here. We work with ECEC and just trying to promote really good organizations pass important legislation. And I personally have history in the field of education. I was a school educator for 14 years. This is my first year not doing that. And now that I get to help promote educators and the field, it's been really lovely to see this side of the work that gets done behind the scenes that I don't think a lot of educators generally know about.
Thanks for that. That's great. And Ami, just so you know, my role today is note taker. I'm going to share my screen in just a minute. I'm going to offer you a set of questions. We'll do one at a time for you all to discuss, and I'm going to take notes. You know, my notes will say Katie and like a little bit about what you said, right? If Katie is to share, just as an example, or Ami or whomever. Just for our note-taking purposes, I'm going to share my screen so you can see what I'm writing, and that way if I misunderstand, you can correct me in real time too. But we'll just take it one question at a time. And I just thank you for spending a few minutes revisiting or visiting the deck again. I do want to acknowledge that there are updates so that report went out, and while we're still working on the final report, and there are some updated figures that will be in the final report. Michaela noticed, of course, that some of the workforce data about salaries is actually outdated. So what's in the deck is from 2019, if I remember correctly. And there is a newer report out that has, is that my understanding is a wider range of salaries is sort of been, do you want to speak to that just for a second, Michaela?
Yeah, I thought it might be helpful to provide how compensation is collected in Oregon, because it really limits what we can say about it. So it is collected on the licensing application for centers only. So when a center renews or becomes a new center or reopens, they're asked on the licensing application what they pay their lowest teacher. It's teacher, head teacher, which are now a combined for licensing purposes. So their lowest teacher salary and their highest teacher salary. And so we have two numbers to go on. It's not an individual person number, which makes it really difficult to be able to give a really good range of what it is. And so what the numbers that we are able to say is we're able to say of teachers who are the lowest, who get paid the lowest wage in their center, the current 2022 value is $33,000 is what they would make if they were at the lowest end of their center's salary scale. And then if they were at the higher end of their salary scale, the median is 45,700 currently as of 2022. And so we're not able to give a really big range because a median is half or above, half or below. So if they're at the highest wage of their center, half of them are lower than 45,000 and half of them are above 45,000. And the actual range is like 20,000 to 60, or it's like 100,000, I believe. 120,000 is the highest range, but there's very few people, very few centers who pay at particularly that higher range, and as well as that like lower range as well. Most are kind of paying in that middle. So it's not an exact like childcare providers are making between this and this. We don't have the right type of data to be able to say that. But it gives us an idea of what the salary ranges are.
Yeah, I really appreciate that.
teachers.
Yeah, I really appreciate that clarification, Michaela, for lots of reasons. And we'll work on in the final report making sure that it reflects that more accurately. I think it's a blunt instrument, right? Or a blunt measure, an imperfect measure, but gives us a sense of where things are. I think the takeaway here is still the same, that educators are clearly not paid enough, right? So if we sort of worry less about the details today for the purposes of this meeting, which again, thank you, Michaela, for the clarification. I think it's super helpful. And we focus today more on like, what might we do about that, right? I think that will be really productive today. So I'm gonna pull my notes document up and offer you the first question, which is similar but slightly different from the question that you got in your pre-work email. Let's see if this behaves. Okay, hopefully you can see my screen and not my text messages or my email browser. Are we okay? Okay. Is that large enough for folks to see? Okay, great. So this first question is, what's the key role that you or your organization, your institution, your program might or could undertake or continue to support the advancement of systems toward more equitable, responsive, and accessible practices to help improve the support and needs of the workforce with compensation in mind? That question is a mouthful and a handful. So really it's asking, what might you or your organizations do about this problem or challenge? What might that look like? What sort of role might you and your organizations play in addressing the compensation challenge as described in the findings? And Nadra, I see your question in the chat. We'll try to get a link to that report. I'm sure Michaela's already on it. That's great. And anyone can jump in here. We don't all have to answer every question, but it's great to hear your thoughts. So what roles might you or your organization play in working on this issue?
Can I ask a question real quick?
Yeah.
On the study itself? The way some of these bullet points read, it reads from a very center-based perspective, and I was curious about how much of the interviewees, or especially from the primary research, were family-based childcare.
I don't have the specific demographics in front of me, but they're not only inclusive of all different kinds of childcare, but also other types of early care and learning professionals. So home visitors, mental health staff, etc., were included. Yeah, and thank you for that note, because that's something we're working on, trying to make clearer. Yeah. Happy to field other questions, but would love your thoughts about what might it look like to address this.
So Kim, I'll tell you from a district's perspective, what we have done is made sure that our teachers in the preschool promise classrooms that we host in our district are compensated the same as any teacher in our district, so they are on the same salary schedule. However, I do have to say that that poses a problem for our programs, as it, it takes away. I don't want to say that it takes away, but it hinders our ability to support the students the way that we want and that we should, because we're taking some of that grant money and putting it to equally pay our staff members. Then we're really taken away from our ability to support the kids the way that we should. Both are important to us. I'm just pointing out that this is not a sustainable or the best solution that we can be making.
Can you say a little bit more about that? Like what would those
So,
dollars go instead toward?
yeah, for example, we have students who are just the reality of early learning in our community, in all communities, I guess, is that our special education community partners are underfunded and understaffed. And so when we have students who come to us with an IFSP, and our teachers are not trained to serve special education teachers, then when we don't have funding to contract with specialists, or we don't have funding to hire more staff to implement safety plans or things like that, then we're taken away from our ability to serve these kiddos, because we are putting our money somewhere important, but nonetheless, it's not for the kiddos. That's just one example.
Okay, I think I'm following. Thank you.
The other piece is facilities, like making sure that our facilities within the district are retrofitted, and we try our best to follow the grant and whatnot, but it's not what it should be. The idea, not looking for the ideal, but it's not even the best that it can be, or even closer to that.
Yeah, can you say more about what ideal would mean for you? Like what would it look like to be able to do?
Yeah, I didn't want to say ideal, because
Yeah, that's probably not the right
in
word.
this world, but for example, having a bathroom in the room where kids can access it, have it retrofit the bathrooms to be preschool friendly, lower all of the countertops, just making facilities more 3 and 4-year-old friendly.
Okay, and you don't have the dollars to do that because, or what you're saying is one of the reasons you don't have dollars to do that is because you're paying high salaries. Or
That's one
salaries that are parallel
That's
to.
one of the reasons, but we're not talking about here. The funding in and of itself just coming in is not enough.
Right,
Yeah.
okay.
Yeah.
Thanks for that. Others? Thoughts, reactions?
Again, I'll speak to so part of my role here is also representing the union for AFSCME for family childcare. So I would say that, like, we've always in bargaining, we've always tried to have equal pay, right? Because we're based on zip code. Depending on what zip code you live, depends on your pay of like ERDC and things like that. And so it's really hard when you're in a lower paid area to be able to pay your teachers. And I can piggyback on what she was saying, is like every year, if you're a family child care with preschool promise, every year you don't know what kids you have. And so then you have to, really redo your budget on, like, sometimes you need more teachers in your classroom to help with the students with IFSPs. And so, like, some years you're having to scrape, I guess, things that you need to do your preschool program with, in order to save that money to hit salary that you need. And every year is different. But for family childcare, it's so hard when everyone is trying to pay that wage, but we don't even have money for our own health insurance. For my husband and I, we pay $1,990 a month for insurance, just to have health insurance because we don't have health insurance. And so it's really hard, at school district levels, they get their pay plus all the benefits. We're trying to compete with that, and it's just, you can't.
And I would add that if it wasn't like, I can't even imagine how a standalone daycare or center or home provider would be able to do that if it wasn't for the in-kind support that we get from the district. I don't know that we can like stand alone and have what we have right now if it wasn't. And part of that is the, some of the benefits and some of the just just liability insurance and what have you.
Yeah. I appreciate this, and it's so easy to talk about what's hard about this, right? And what the challenges are. And I would love to push us to the extent that we can toward like what might we do and what can we do. So Nadra, I appreciate you sharing, like, this is sort of your circumstance and your situation. Are there others who can speak to ways that they or their organizations are doing things or might do something to help move us forward? I know this is a tough one.
So I can speak to one of the things that we administer. We administer the startup and expansion grants to early childhood programs. And I should say, we have to triage all the applications that come in because we only have a certain amount of money. And we try to target places with higher needs. But I should say the funds that we do give out, they can be used for at least 2 months of salary. So it's a short-term aid that doesn't continue, but it's there to at least help kind of bolster a program as they get started. Like I said, I'm trying to remember the actual numbers. I think we got 500 applications last time, and we were only able to give out to 125 programs. So it's like 20% of the people applying only, get funds from us.
Yeah. Appreciate that, Patrick.
For us, I think it's a little bit different than what most of you all do, but I think that hosting, for example, that workforce barrier session that we hosted at Capaces really helps because it brings a lot of the educators together and it gives them the availability to voice their opinions. And for example, that day that we did that, compensation came up a lot, and just that way you all are able to know the needs of the community, and then something can be probably done in the future.
Mm-hmm. Thanks.
I think this is Katie with Oregon Ask. I think we kind of fall in a little bit of a similar category, as in, an intermediary organization. We don't provide direct service. We're also not a funder, so we're not necessarily helping sort of fund programs or directly tied to how they're doing their wages and spending. But I think what we have done around this and could do in the future, it falls a little bit more into sort of the advocacy role and the awareness building, as well as then sort of trying to help connect programs with the existing resources. We focus more on school age, and so it's a little bit like on the later side of the early childhood workforce. But a big thing that we try and do is know about how school age programs can apply for ERDC and help connect them with those resources and try to help them make use of what already exists.
Mm-hmm. That's great.
I can speak a bit to OCCD. So we facilitate multiple sources of funding for providers, including education awards, scholarships for both community-based training and college or university tuition. And this year we started to disperse workforce recognition payments as well, which puts money directly in the hands of providers who are working with children. And I can say that we have gotten the word out quite a bit, and we're getting really good at giving out money and getting it into the hands of folks who are connecting with us. But what we're seeing is that folks are connecting with us at higher rates, which is fantastic. But the stability of funding impacts how helpful it is for folks. So particularly around scholarships, the early learning degree program scholarship funds were depleted fairly quickly. So folks who went back to school counting on those funds being available, once the funds were depleted, had to find other ways to either continue or had to make decisions, right? And so, like many of you were talking about, the funding is scarce, and so it feels inconsistent to folks, I think, in the conversations that we're having.
Mhm.
And in the slides, it was mentioned about the workforce recognition funding. Folks are really happy to get that $500. They'll get it this year and next year, but funding after that is not guaranteed. Well, none of our funding is guaranteed, but it's not an ongoing thing. And so having consistent funding would be much more supportive of folks who are doing this work and who are looking to move up in their professional development as well.
I hear a couple of things in what you all are sharing. I hear about like awareness and communication and letting folks know about existing resources. I hear about advocacy, right? And awareness not just for the problem, but for the nuances of it all, right? Are there any other like roles that your organizations might play in addressing the compensation problem before I ask you the next question?
I can just speak from the research side, and it's
Yeah.
less on the addressing and more on the just awareness as a research partner and kind of the partner that is leading what compensation is in Oregon and analyzing that data. It's collected by the Office of Child Care through DELC. But just I think when I think of like my role at the university in lots of areas is really just providing the data to make data informed decisions. And so I just see that kind of as a role we make that we have is bringing that data forward to help know what's out there and help make data informed decisions.
Yeah. That's great.
And I would also say OCCD is involved in a lot of conversations around how the registry and the steps might help to capture the professional development of folks to create some sort of standards, not necessarily the right word, but some consistency in the ways that folks are, my brain is racing. So, but just trying to provide some structure around how providers might be able to demonstrate or quantify their experience, their knowledge, and some standards around how folks are classified and paid. We have that with licensing and centers, but we're still having conversations around what that might look across the state in a multitude of settings.
That's a great example, I don't know if that's even the right word, of the way in which compensation is connected to like everything else, right? Like it's hard to talk just about one of the aspects of the challenges because everything's intertwined with everything else, right? So just to acknowledge that, we know that. And that makes these conversations tricky. But The next question is about what key partners or collaborations that you and your organizations need to help advance the work. So whether it's work that's already happening, work that would be ideal, what are the sort of key partners and collaborations that you really need to advance this work? And just so you know, the next question is about resources. So if that helps you, key partners or collaborations to start. I suspect we'll have lots to say about resources, but
I know for family childcare and preschool promise, just for families or for the state to listen to the people that are working the field and the resources, you know, the just listening to what we need.
yeah. What in what ways or what does that make possible?
I think the biggest way is financial, when you're in a state, you know, ERDC or preschool promise, that they listen to the different aspects of, you know, they want everybody doing it. Mixed delivery, you know, and so in the mixed delivery, they need to listen to, we're different, like we're all paid exactly the same, but our budgets, you know, some schools may have more resources than in home, you know, we're paying brick and mortar and teachers, where schools a lot of time has a classroom that that funding don't have to go to.
That's really helpful. Mm-hmm.
And insurance needs, like our insurance for having our preschool in our house just changes every single year. So that again, you have to revise your budget, because you can go from paying 3,000 to last year paying almost 13,000. That's a huge dive in your budget. So, that's not the state's fault, it's the insurance companies, you know.
And I hear that you want them to at least understand that.
And it takes a long time. Like right now, we're in the process of trying to get them to make an adjustment, and it's taken a really long time. But then everybody's insurance, some people can't get insurance. And so if they can't get the insurance they need, then their salary, their budget's on hold. They can't get any money to pay their teachers and things like that right now. So there's a lot of things for the providers that are going on.
Yeah. Would you say insurance has gotten to be a much bigger problem pretty recently, or has that have been an ongoing issue?
Yeah, there's been changes to the insurance over the last couple of years that have put some of us in binds, that we've had to get a certain type of insurance to cover the limits that they want. And then in return, now it's not working. I don't know how to explain it, but yeah.
Yeah. So I hear that DELC and the state and the various agencies that control some of these things are important partners and collaborators, or at least fellow understanders in this. Does anyone else want to speak to either that, some aspect of DELC or the state specifically, or other partners or collaborators?
This is on the other partners and collaborators topic, but from a school age perspective, like thinking about like after school programs, especially in the early elementary, the school districts can be a really key collaborator or partnership. Like school community partnerships can be really powerful, not just for outcomes for kids, but it's also can be a way to tap into funding or space usage or transportation that can free up funding that can then flow back into compensation. So that's, I think, a really potential source of collaboration.
Yeah, and I can build on what Katie said. I mean, we know that a lot of districts are trying to become, you know, preschool through to age 21 districts. And with that, I feel that there's a little bit of a disconnect between DELC and ODE. right, you know, and maybe it's not a little bit of this, maybe it's a lot of disconnect. I
These
see everybody
face reactions on the screen.
a lot, a lot of disconnect. I want to see legislatively, I want to see how the general fund is going to start supporting our early learning programs. And I know this is a big topic and it's triggering to many people, but that is where the problem lies. It's in the, you know, and we're talking about legislative changes with this effort, and I appreciate that. But until we start advocating for preschool being a right, you know, and we put our dollars behind that, I think we're going to continue to see some people like our colleague here, Autumn, and all of the centers and private providers continue to extremely struggle with providing quality care that our students deserve.
Thanks for that.
Just to piggyback on that, not as a Fifth Element contributor, but just as a previous school educator, I found that there was a really big disconnect in the district that I grew up in personally, where the high school was its own district, and then elementary and middle school and younger were their own separate district. And having that balance where the high school and older had their own set of you know, rules, people who were looking at the rules, like the administration was completely separate, versus being in districts here where it is everybody is trying to be under the same set of expectations, but the age range is so vast that it doesn't make sense when, to me, when you're saying that you want the same rules in a K-5 building or in a pre-K through 5th grade building, and that same general set of like rules or boundaries has to then be followed through high school and older. It just is a really interesting difference. Yeah, and how everything is done here versus in other places.
I hear in that maybe the need for like more differentiation across age groups. Is that fair?
Yeah.
Okay. As a way to put it, at least.
Yes.
Yeah. Interesting.
Also, I just wanted to say thank you all. This has been like a really, just hearing all of you, I'm like, oh yeah, as a teacher, like I can resonate with almost everything that you're all saying. So thank you for sharing everything.
So I was going to add, we as the administrators of Find Childcare Oregon, and I don't know if we actually can do this through Find Childcare Oregon, but a way we could probably partner with other groups is maybe promote resources where providers could find funding, as here's a resource page or something like that within that program. I had to see if we could do that, but I don't know. But that's a way we could possibly collaborate and get information out.
And I appreciate the like willingness to think creatively about some of this, right? What else? Other partners or collaborations that you really think are necessary for advancing, I'll say, improvement around compensation? It's very broad, but. I'm mostly really good at holding silence, but. Okay, should we talk about resources? Because I'm picking up that that's the root of this, right? Which is not a surprise, but appreciate what you all have shared around this so far. What do you feel like are the key resources that you and your organization need to help advance work around compensation? I heard us already name just more funding generally, right? So we can just put that on the list. More funding. And I heard you, Nadra, mention the general fund specifically, right? Which would be a change in the way that the state invests in early care and learning, early learning. What else?
I want to highlight, like, and underscore perhaps the special education support and social, emotional, and mental health support in all of our preschool, anything early learning. Um, you know, we're seeing this in K through 12, and the K-12 system is awakened to, like, oh my gosh, this is a real need right now. We need to start thinking about that. And, you know, some movement is happening over there. And it starts in early learning, like all of the kids, and we're not even capturing all of the kids who need the support because we don't have preschool for all yet. So how can we continue to support the programs like EC Cares and other community partners to find those children and give them the support that they need, so when they get to K-12, they have the resources and the support to go on.
Thanks for that.
Something is percolating in my brain, and I'm not sure if this fits here or not. So one thing that I hear a lot from providers who are looking to move up in the steps or improve their professional development is that they don't have release time in their programs. They don't have time that they can use to take professional development to then move up and improve their skills and provide the quality care. So I think one of the supports that providers in this instance need is could be built from maybe the substitute pools and flexibility around being able to attend professional development and to learn, which then it will hopefully improves their compensation and their retention within the field as well. So it's not something that I need or my agency needs, but I hear that from the folks that I work with who want to attend training and just simply don't have the time, particularly folks who are providing care in their homes. And they're just exhausted by the time all the kids go. And yeah.
Kim, can I revise? Maybe not, it's not something new, but revise my feedback earlier about special education.
Yeah.
We're talking about compensation here. And so the place I wanted to go there is provide adequate pay for special education support.
Yeah.
Or provide funding to train our early learning teachers to be able to support special education teachers with, you know, even higher pay than somebody who doesn't have students with special education needs in their class. So there's, just as we do in Jeanette in K-12, we have special education teachers, we have mental health support, we have all of that. And in early learning, because our community partners are underfunded, our teachers struggle and they are not paid for the work that they are doing and we're having them do. They're under trained and underpaid for that.
Yeah, I appreciate that. Are there any particular partners or collaborators that you feel like are really important to making that happen? Like what might it take to make that happen?
you know, again, I like to look at things of, you know, not robbing Peter to pay Paul, right? Because, you know, we're already in shortage, so legislative stuff that, you know, that can funnel some funding towards that.
Mhm. Thanks. That's a great transition to the or not really a transition, but a great combination of the partners and the resources question, really, right? Because you're talking about your community partners needing that support um, as well.
So I'm not sure if this fits here, but just something I've been thinking about a lot. And it's not like a solution necessarily, but I'm on the board of directors for my children's childcare center. And so we're faced with the compensation issue all the time. And as a nonprofit childcare, we don't have any option besides passing that cost on to parents. And I don't know, I don't have fancy ideas for the solution around that, but I just want to acknowledge that's what's happening is the every year, particularly in childcare, particularly being um a low wage area, the increases in minimum wage every July, which then also increases payroll taxes. Like every July, we have to sit down and be like, can we make it? And how much do we need to increase tuition for parents to cover the cost of that additional paying them? And we would love to pay them more, and it's like a salary, so the lowest minimum wage increases the lowest like aid position, but then you have to move everyone up for equity, so everyone moves up, and we would love to do it more than that in addition, but we also can't pass all of that on to parents and still have parents being willing to pay for childcare. And so I just want to acknowledge that's kind of been the solution, is to pass that cost on to parents, and I don't know how to get around that. You know, we haven't figured out a way. We do fundraising, we do lots of things to try to have some additional funds come in. But it really comes down to passing it on to parents, even to pay what we know is not adequate,
right,
to compensate for what they're doing.
I appreciate that acknowledgement.
And just adding to that, you know, the tuition is at all-time high right now. Like it's $1,900, $2,000 per child to enroll in a quality care. And so, you know, and there are places that are a little cheaper, but that's an average. And so how much more can we add to the parents? And that's why I keep calling for legislation, you know, general fund, things that come, you know, let's support early learning the way we support K-12.
Yeah, yeah. So let's get into that a little bit and talk more about what policies might it require, right? What might it take to make those changes? What changes do you want to see happen, and do you have a role in those, or what might your role in those be, right?
For the union, it's our bargaining, they're bargaining right now. I'm not part of that. So I don't know exactly how that's going, but that's kind of how a lot of the providers are based. Like that 1,900 is not, that's half of what we get in Salem. Like we don't even get that. Preschool Promise does it's not even that. Like,
I think that's private pay tuition rates. That's not ERDC rates.
but I know, but if you're shopping, does that
Mm.
give families the adequate resources to shop for childcare? Right? They can't shop for childcare if they can't pay that.
Yeah, that's why I said quality, like, and I'm not saying that EDRC and preschool promise is not quality, But if you don't qualify to be in those programs per your income, then the next thing is to pay the $1,900.
Yeah.
So what I would add to what Autumn shared is we need a minimum ADM funding for any child who is in childcare, whether in private or preschool. Well, preschool promise comes with the grant, but any child who is enrolled in preschool or any early care, not just preschool, comes with a minimum funding, like similar to ADM.
Can you say more about what ADM is? I just want to make sure that I'm tracking.
State school funding, every student who comes to a school district or in public education comes with a funding source. And I think it's a kindergartner, I believe now is 11,000 if it's a gen ed student. And then if they're SPED, then they are time and a half and so on and so forth. If they're, a student in poverty, they tag on some more percentage of that ADM.
Thanks. Oh, Autumn, you're muted, but I can see you.
Oh, okay. I would say tagging on that with that policy change is like kids that, like if they're on ERDC and they're special ed, then they get more funding through inclusive partners. Like preschool promise doesn't get anything. Like, so it doesn't matter how challenging a child can be, you get that base pay. So you have no extra fundings to support that child. And so I think that needs a policy change. I mean, if we can have that extra funding per child, every child's different, so like, yeah, that part's really hard.
That's helpful. I hear again that notion of differentiation, that it's more nuanced than like any one rate or any one change could be. What else? And Lizette, we haven't heard from you in a little bit. Anna, if you have thoughts.
Yeah, I'm just listening, and I think that most of the ones that everyone has shared fall within as well. So yeah.
Appreciate that. Jump in anytime.
It's just a small thing, but I would add, like, as we're talking about policy changes, that it would be really great to see policy changes that are long-term or ideally permanent. It's like having mechanisms for reliable, consistent funding, I think, is really important to be able to then expect high quality programs. It's so hard to produce high quality care for kiddos when you're struggling for funding and don't know where it's coming from every year.
Which I think comes back to what Nadira was saying about the general fund and just the way that stuff is funded. It's talking about a big reform, not a small reform. Yeah,
exactly.
I would just echo that. With grant funding being unpredictable and not knowing sometimes until the last minute what the budget is, that causes maybe last minute pivots, like someone mentioned earlier. And it can be unpredictable for staff as well. And so in our programs, that can contribute to attrition of our staff and sustainability for sure.
we're already in policy recommendation mode here, I think, but as the more we can get like specific about what our recommendations are, like what you all think should be advocated for, I think the easier time we have in putting that into writing, the easier time the state has in understanding what the field wants, right? So if there are other thoughts you have about what both big, we've been talking pretty big, but also small, right? Policy recommendations might be like, what would those look like? If it's helpful to talk
Like,
small for a few minutes, we can do that too, right? There are small things that can probably be done as well as the big things. Sorry, Nadira, were you going to say something?
yeah, I was gonna say, I'd like to see some recognition of our staff who come from diverse backgrounds, maybe bilingual staff, maybe staff of color, that, you know, we are having a lot of challenges retaining, that there is some sort of stipend pay differential or whatever that might be for our staff who have extra skills to support our students.
That's great. That's a really good example of something that could happen at like a really small, small level, right? Within a program, at a district, statewide. Like some of these things can scale and some of them can't, right? Like changing the way that early childhood is funded completely can't scale in the same ways as that example does, but I appreciate that.
Yeah, but I don't want this to come from the centers. Like, I don't want us to add more to, you know, Autumn's need to pay because she already doesn't have money. I want the state to fund that.
Right. Good
So
point. Good point. You don't want to create impact on other people.
Yeah.
Good point. It's a really good point.
The other piece is I'd like professional development, especially the courses and education that is required by DELC to be part of the staff's compensation packet.
What policy would have to change, or what would it look like for the policy change? Does that have to happen in licensing, do you think, or somewhere else?
Yeah, I would think that part of them getting enrolled to become a childcare support person is for the state to pay them to get those trainings. Like there's 3 days of pay for them to really sit down and actually get trained, because that's, in my world, that is the biggest deterrent for us to find staff to actually want to work in our programs. Like we have staff members who say, "Oh, I'd love to work with these kiddos," and then we say, "Oh, and you have to do this on your own," and they're like, "Nope, thank you."
Others, small, big, in between, realistic, ideal. What's coming up for you? I think we can think of policy like small p policy too, not just a law that needs to change, but practices or policies within institutions or organizations.
I think I have to be off video for a few minutes, but I think one thing that has come up in some of my work too is we know that that the private pay, what was being charged to parents, doesn't necessarily cover 100% of what it costs to provide childcare, like the true cost. Federally, as far as ERDC, there used to be a law that said you could not charge ERDC, like you could not get ERDC more than what you charge private pay. So if you had both ERDC and private pay, you couldn't. Federally, they have lifted that, but it is still in Oregon statute that a provider cannot charge an ERDC family more than they charge private pay families. And so one thing that could change was changing that statute to allow families, when they have ERDC families, to receive a higher rate. Often that ERDC reimbursement is a higher rate than they charge private pay families in a lot of areas of the state. to be able to kind of help cover that we know that true cost of care is that higher rate. So that could be a policy change to change Oregon statute to match what federally they're now saying, that they can charge that higher rate to help with that true cost.
Yeah. Michaela, do you know that to be statutory, or is it, would it have to be legislated?
I am not sure how to change it. I know just in a recent meeting, it came up again, and someone from Delk said, yes, it's still an Oregon statute.
Oh, interesting. Okay.
So I don't know where it is or what would have to happen to have that change.
Okay. I'm not sure either, obviously. So
Yeah.
that's the question. Thanks.
But I know, and I went to a federal childcare policy conference last June, and that came up a lot of different states saying they had to go through their legislature to lift that, because once the federal changed their requirements, that other states had to go through their legislature to have that lifted to be able to do that difference.
Okay. It's good to know. What else? What might it look like? If we can imagine what it would look like for the state or local government to make changes in the direction we think we need to head, even if it's complicated, right?
I don't know if this would go in here or not, because I know a lot of providers right now that are in the preschool promise programs or whatever are having a hard time. Is like they give priority to children with special needs, but then a program can be like the whole program be a special needs program. And so then with no, I don't know if that would go in here, and like having a limit. I understand priority, but if it's given 100% to children with special needs with no extra resources for providers, that's what a lot of providers are struggling with right now.
Yeah, it's helpful. It's a really complicated issue, right? Because compensation looks like a lot of different things. One of the things that we heard a lot, and that you saw in the deck, is the need for not just paying attention to pay, but benefits. And that hasn't come up yet. Oh, I see nodding. Good. Do folks have ideas about what policy changes or efforts to move toward improved benefits might look like?
One of the things, go ahead.
No, I was just say tell the state to listen to bargaining for us. That's one thing that they're going after this year. So
yeah, I know that the unions have advocated for benefits for a long time. Yeah.
One of the things that came in the slide deck is the mental health support by the employers. And some sort of policy around employee assistant programs, like counseling or therapy or even skill building, social emotional skill building, for our staff to, and school districts have that. I'm talking about in general for those who don't have it, but employee assisted programs for staff to access for life support and mental health.
That's great.
So I participated in quite a few of the listening sessions with the NWRA review last year. And one of the things that we heard was a lack of real data on benefits that were offered by different centers, providers, because that data is used to inform a lot of decisions, but there's inconsistency in what that actually means. So for example, we heard from staff that their center provided health insurance, but it was at such a high rate that it wasn't accessible, and so it wasn't meaningful. Or they provided 8 hours of sick leave every year, and that wasn't adequate for what the need was. So there's this checkbox that yes, they provide a benefit, but without an in-depth understanding of what that is to recognize how useful that actually is. So I'm wondering about standardization of and more in-depth data on what is actually being offered around the state to be able to inform this work better. That was convoluted.
No, I think it's
I
really
took a path to get there.
well, and I'm tempted to ask Michaela to speak to what she knows about data around this, but I don't want to put you on the spot, Michaela, about that either. So
Yes, I'm happy to. I was just going to pull up what Anna is talking about. So at the same time that compensation, like salary, is collected, there is a checkbox on the child care licensing application that asks whether a center provides any dollar amount towards benefits. But from what we're finding, it seems to be a mismatch, and we acknowledge this in the report too, for what I'm trying to pull it up of how many said. So 72% of facilities said they offer health insurance. But as Anna was saying, that could mean
might not be real.
that could mean they offer that the employee could buy into health insurance, and not necessarily that they are like paying for that health insurance. So there is a huge discrepancy in like what that could mean, that we don't have a way to answer with the current data that's being collected in Oregon, because that could mean a lot of things. And when we look at the percentage of facilities that say they're offering these benefits, it's just really unclear whether they're not offering it at the same rate. Like some, like for instance, those that are affiliated with a school district or a university or an organization may offer full health insurance and benefits. But another one that's a nonprofit may check that they offer it because they've subscribed to a plan that the employee can pay into, or and same with like retirement options. Like they provide information to their employees that you can buy into these retirement options, but they're not actually contributing any amount to it. So there definitely is a need to understand that better and get better benefits data.
And this is gonna sound weird coming from a researcher, but I appreciate this as like another little p kind of opportunity, right? If we need more information to inform decisions, like that's a recommendation that seems much more doable than like, let's change how early care and learning is funded. Which I would love to also see happen. Now I'm really jumping out of my supposed note-taking role, sorry. But I also wonder if we already know that, early care and learning professionals are saying that they don't have access to benefits consistently. If we already know that they're compensated insufficiently and they're needing more access to benefits, can we take action without waiting for more data? I feel like we're really good in Oregon at like saying we need more information and that delaying action, right? So I'm both like all for more data, and I also wonder like what might we do? So I'm going to ask my question again, like what might we do around benefits? Or might we recommend around benefits beyond that capturing additional information? I think it's both and, right?
One thing that we've heard from like after school and summer programs, especially ones that are run by like smaller community-based organizations, is that the costs of providing healthcare or benefits are so high because they are so small. Like getting a small group health insurance plan is a lot more expensive than buying into a big group one, and same for a lot of benefits. And so we've been hearing talk from community-based organizations, like, are there ways to almost pool resources? Like, are there ways to build access to big group benefit plans for people that are in this field, even across like different, diverse organizations? I don't necessarily know how to do that, but it could keep costs lower, maybe.
Yeah, or what might it look like for the state to somehow facilitate some sort of collaboration around that? Yeah, that's an interesting question. Thank you. And thank you, Michaela, for letting me put you on the spot too. I appreciate that. And I am an advocate for more information almost all the time. So what else comes up for folks? Any other ideas or potential recommendations around benefits?
For benefits, something that I've heard as well is like retirement. A lot of times, especially those who have in-home childcare centers, who we kind of work with the most, don't know where to start, like a Roth IRA or anything like that, because they're not working for someone, it's their own business. So it would be good to have those resources as well.
Hmm. So I hear in that like education communication would be
Yeah.
valuable. Hmm.
Mhm.
What else? Anything else coming to mind? Is there anything else that we haven't talked about that you want to make sure that I hear related to compensation, or that you want to make sure the state hears around what they might do about compensation and its challenges? What else? And we are going to all come back together at some point, not at some point, at a specific point in time. So don't, even if we wrap this conversation up, don't go anywhere yet. But what else? We're in the what else stage of the conversation. Are we running out of steam? That would be very understandable. Okay, here's an invitation to you. Let's take 10 minutes. Take 10 minutes to take care of yourselves. Take a break. Do what you need to. Come back at noon. We might still be in limbo waiting for other groups to wrap up, and we might not. But if you come back for me at noon, then we will just have one more opportunity to say things that we want to make sure that we have down from this conversation, and then we'll join back into the full group again. Does that sound okay? Okay, I'm gonna pause recordings and I'll see you back at noon. Okay, thanks so much, everybody. take another minute if you need it. And when you're ready, you can turn your camera back on for me or just let me know. We'll do a little bit to wrap up and then we'll rejoin the full group. Hi. Hopefully that was an appreciated and needed break. It was for me. So I know these meetings are a slog. It's going to be a long day for those of us who are here all day. So I appreciate your time and energy and all of the ideas that you've shared already. I am wondering if there's anything else that occurred to you while we took a little break, things you want me to know or to be thinking about, the study team, things. Sorry, I'm scrolling. This is horrible to watch, but anything else? Any other recommendation, considerations, things you want the study team to know, etc.? No. Okay. I'm going to drop my email in the chat. If a thought occurs to you later that you did not want to say in front of the group or that you just occurs to you later, reach out. I encourage you to send me an email and I will share back with the rest of the team. As you know, and you'll hear a little bit more about when we join the full group again, we'll be pulling together recommendations very quickly. We're operating on a wildly tight timeline from here, and I'm wondering if any of you would be willing to commit now, to the extent that you can, to review those recommendations and offer your feedback on our draft, which would probably happen this week. Nadra, wonderful. I'm still not saying your name right. I will get it eventually. And if you want to let me know,
I can.
Hi, Autumn can. Awesome. Yeah. And I saw your hand, Michaela. Did I miss anyone? And Katie too. Wonderful. Ami's in it, whether she likes it or not, because she's part of the study team. Anna or Lizette, any capacity or ability? Patrick?
Anna and Lizette in the chat also.
Oh, wonderful. Oh, thank you. I missed that. I'm looking at too many things at once. Thanks for the group effort.
Can I put myself as a maybe? I'm at a conference for the rest of the week, so I just don't know what my capacity is.
Yes. Are you at AEA, Patrick? I'll see you there.
Yes.
Yes. That is very understandable. Okay, wonderful. Thank you all so much. I'm going to close this break. Oh, let me put my email in the chat before we join up with everybody. I'm going to close this breakout. I think that will stop our recording and then you'll be back in the full group with the main recording. But again, welcome to reach out. Michaela, I'm sure we'll be in touch to make sure we got the language right around salary especially. And thank you all again so much for your experiences, insights, perspectives. I know this is a lot and I really appreciate it. Okay, I'm going to close us. Let's see if it'll cooperate. Maybe I can't close us. I will see if I can get some help to close us. And if not, you also can go down to where it says breakout rooms and you can leave the breakout room. Just don't leave the whole meeting. Leave just the room. And I'll get Nelda's help closing us. Awesome. Did you find it, Patrick and Lizette?
I'm trying to figure it out. Sorry.
Yeah.
I have leave room, but not leave breakout room.
Oh, yeah.
Okay.
If you click on that, I think it'll
got
give you an option. Okay, good. Okay. I'll stay with you, Lizette, until we figure it out. Okay.
I'm gathering we're having more people join us, right?
Yeah, there's going to be about 8 of us. Okay. Looks like. We'll do introductions, then we'll go through the questions. So I am just getting all of my little pieces and parts together. Okay. Start checking people off just as we're waiting for everybody to come in. Make sure I can see people who don't have their screen on. Okay, I know I saw a couple more people in the main room. So I'm gonna give it probably till 2 more minutes, to like 10:24. Okay. And honestly, if you wanted to jump ahead, one of the first things we do also is just check in with everybody and make sure that they've seen the findings, and then if they want to check, have an opportunity to refresh their memories, you could start doing that too if you want. And I will go ahead and even just put that link in.
For some reason, I can't click onto the link.
All right.
Sorry about that.
No, you're all good. Let me see. Share. Let me try to share it this way and see if that's a better link. Let me see if there's. So. And let's see if that version worked. Hi, welcome. We're just waiting for a couple more to join. Lovely to see you.
It's having me request access, but I sent the link or sent my email.
Sent the request in. Good.
Yeah.
Good. Yeah, let me. It's in a quick chat too to get that. Go ahead and put that ask in, but we can go ahead and get started. My name is Melissa. I am a colleague and partner of Nelda's at AB Cultural Drivers. I will be facilitating this conversation today. So my role is to guide us through the conversation. I am not going to actively participate in it, though I'll be facilitating. We thought we would start with just sort of saying hello and telling us a little bit about who's in the room together. And let me see. And so we're asking everybody to start with their name, their pronouns as you want to share them, your role in the organization that you're at. And yeah, and then if there's anything incorrect that you see on my screen, if you can't see my screen in terms of your role and your description, please let me know. So we will update that as well. And let's just go ahead and go in the order of the names on the screen. So Elena, would you like to go first?
Morning, everyone. My name is Elena Barreto. On the screen, it should be 2 R's, 1 T. It's the
Good.
last name. Yeah. And I use she, her, ella. I'm the early childhood policy advisor at the Children's Institute.
Okay, Jennifer, would you like to go next?
Sure. Hey, my name is Jennifer Rice. I work for the Higher Education Coordinating Commission. My pronouns are she, her. I am a workforce industry specialist focusing on 4 key sectors, including early childhood education.
Welcome. And then the Representative Nurin's office. Apologies. Marcella, would you like to say hi?
Yes, hi, thank you. My name is Marcella Martinson, and I'm here representing Representative Courtney Neron's office. Representative Neron serves on the Early Childhood and Human Services Committee in the House and is the chair of the K-12 Education Committee, is a former teacher, and I myself, prior to my policy work, was an early childhood provider in my earliest years. And now I'm the policy director and chief of staff in her office. So happy to be here.
Thank you, Marcella. Can you tell me your last name again?
Yes, Martinson, Martinson.
Okay, Martinson. Welcome. We're so glad you're here.
Thank you.
And then Robin, I think you're next. Would you like to say hello?
Hello, my name's Robin Harris. I'm with, I identify as she and hers. I'm with Oregon Public Health Institute right from the start. Project where we work with African and African American childcare owners. I think that's it.
Thank you for joining us. Great. Leora?
Hi, I'm Leora Berry, she, her. I'm the executive director with the Alliance for Equity and Montessori Education, a small nonprofit.
Welcome. And then Dana, I think we had Kelly or you, is that correct?
I actually think I'm an add-on. We seem to have a little breakout room troubles, and so I might be a whole new person for you. But Dana Blakeney Hipsch from the Ford Family Foundation. I'm a program officer there, and my pronouns are she, her.
Dana, welcome. I'm gonna write this here.
Perfect.
Okay. And then Carmen, welcome. And then Carmen, are you here as a member of the public viewing interested, or are you a member of sharing as part of the helping to generate recommendations?
I am here to support developing recommendations. I'm at Work Systems, which is the Workforce Development Board in Multnomah and Washington counties.
Wonderful. So glad that you're here. Carmen, give me a second. I'm facilitating the conversation today. My name is Melissa, and I work with Nelda's team at AV Cultural Drivers. Carmen, can I get your last name? Workforce Development.
Sorry, there's a delivery happening at my door right as we're talking.
Right? Okay.
It's Ellis, Ellis is the last name.
Okay. And it was for Multnomah County?
Multnomah and Washington County.
Okay, wonderful. Right. And then Jessica, welcome. My name is Melissa. I'm just doing introductions, and so I'm adding to my list of who is here. And would you like to introduce yourself, share your pronouns, as well as describing your role and organization that you're at?
Yeah, Jessica Rosengreen. My pronouns are she, her. I'm the program manager for Childcare Resource and Referral of Washington County. And so we work with early educators in our region, providing training and technical assistance and other professional development opportunities.
Okay. Right, and is that all of us? Yes, it looks like we're all here. Okay, so we are going to spend about 80 minutes this morning talking about the compensation section of the report. Does that feel like where you want to be? Wonderful. All right, we wanted to start also giving everybody an opportunity, if anybody needed to spend a little bit more time going through the report. That is the first chance. And I think we're still trying to get access to the file. Is that correct? You can't open it with the link that's in there. I am only people. I am going to change it to anyone with the link. I'm going to copy the link again. And apologies for the technical difficulties. And we're going to share. Third time should be the charm. So this is the main study findings. The compensation pieces are, move ahead. It's the very first one, first section. You're at slide 15, can get you to it. Would we like to spend 5 minutes just sort of reviewing the pieces of it? Okay, so we'll come and we'll start talking, back talking. It looks like it's 10:33. Come back at around 10:38. And then we'll begin our conversation then. I'm good? Okay.
Melissa, I'm sorry, I had to step away for a moment. Can you repeat what page number we're starting to review the document on?
15.
Thank you.
Absolutely. Okay, it's 10:40 now. Would people like to come back, or is 5 more minutes? We want to be supportive. So if you would like 5 more minutes, we have time, or we could start soon. So go ahead and throw in the chat if you would like 5 minutes or if you're ready now. Okay. Thank you, Carmen. All right, it looks like the majority of us are ready. Okay, I'd like to sort of start with the first question. And the first question is about what is your key role? So we wanted to start the conversation really grounded in the institution that you're at, the knowledge that you have based on your perspective for the work that you do right now. We'll go up to the higher level of larger policy changes, but we wanted to start first with your world. So thinking about your key role that you or your organization could undertake to support the advancement of systems towards a more equitable, responsive, and accessible practices to help improve the support and needs of Oregon's early childhood educational workforce. So thinking through the lens of compensation. And we'd love to hear from everybody in this group if we could. What is something that in your role you could do to support making for a more equitable and supportive compensation practices? Okay, and I could start us through the list if somebody's feeling, you could also, if somebody needs to say something else, like I read this and it is missing something crucial, let me start here. Please go ahead and feel comfortable starting there, and then we can sort of transition in. If there's something that you need to get off, you need to get off your chest first, that's totally fine.
Hi, I can go ahead and start. I'm Leora. As a executive director of a small nonprofit where we provide preschool, the key role we do is figuring out how to pay our staff and pay them at a compensation level that is appropriate and as high as we can get it, as well as getting them good benefits. We provide tuition-free preschool programs, so we are largely reliant on government funding in order to do that. We allocate, it's around 89% of 100 of our budget every year just towards salary and compensation. But that allows us to make sure we provide high quality, zero deductible health insurance, 100% paid, retirement contributions for all staff within 3 months with no vesting rules of how long they have to be there, and other benefits and paid time off. And the salaries is what we can get, but we're still dependent on, if we don't get a COLA, then we can't give anybody an increase. And, if we look at what are the budget recommendations for next year for 25-26 and where COLA stands for providers on that. But that's the main thing I can do is I can do salary evaluations and have a structure that makes sense and is equitable and make sure that we're not like just paying people higher amounts because they're demanding it, because often the voices that are not speaking out are those that are people of color and women. Obviously, most of our employees are women. So anyway, that's kind of the thing that I can do.
My name's Robin Harris. In my particular role as the Health Equity Program Coordinator for OPHI, we have many grants that support owners of African and African descent to support the work that they're currently doing with families that they are working with. This population is completely underserved, so we haven't even gotten to the point of having conversations about compensation for their individual employees, but we have had conversations of things, what they would value for their employees once they are able to get them, or as they are expanding their businesses. So it's a conversation to be continued, but I haven't been able to get any data on that. Thank you.
This is Elena. I'm part of the policy and advocacy team at the Children's Institute. So one of the things that we do is facilitate the Early Childhood Coalition with partners from across the state and build in a legislative agenda, things to advocate for during the legislative session. We can also support by writing legislative concepts, hearing from folks in the field, and bringing in their voices to build recommendations.
Are you saying that you can use that platform to further conversations about equitable compensation?
Right.
Okay.
This is Jessica. In my role, both I kind of wear two hats. So I shared earlier, I'm the program manager for the Child Care Resource and Referral in Washington County, but I'm also the co-chair for Oregon's Child Care Resource and Referral Directors Coalition. So the CCRNRs across the state. And I think though, in both roles, whatever hat I'm using, whether it's just locally or thinking about the system as a whole as a state, I think the role I play is awareness. So talking about compensation and bringing awareness to those who are in other fields or may not be aware of positions of power that could become allies or advocates in this work. And I also think being an advocate, again, in both of those roles, working in partnership with entities like Elena shared with the Children's Institute and the Early Childhood Coalition, leveraging those opportunities to elevate the conversation and importance around compensation.
This is Dana. When I was reviewing the study, I was really thinking about how we could not only internally use it at the foundation to make sure we all have a shared understanding, but even more broadly in the, kind of philanthropic landscape in Oregon, making sure that, again, we're all grounded in like, what's our biggest challenges in the field? And then what are some shared approaches that we could take to really address the challenges that we face? And so thinking about, how do I organize and help folks learn about this both internally and then externally with other system partners, with other funders. Oh, and Melissa, put it in the notes. There's a early learning funders meeting that I'd love you all to come to and present at.
Okay. And I will, my notes, so full disclosure, terrible speller. I will here to get the gist of it. We're recording with transcriptions. We'll go through and we'll clean it up even more. What your role can be is if I am missing a main idea here, please, or if I got an acronym wrong that you want to make sure is correct, please stop and correct me. And then also, the goal is to have the conversation together too. So if looking at the notes is distracting, go ahead and even just like stop that view. The main purpose here is to share the information. Okay, so apologies. So for the study, thank you, Dana. Right. Who else would like to share?
I'll share. So my name is Jennifer Rice. I'm with the Higher Education Coordinating Commission from the Office of Workforce Investments. And as I mentioned, I'm focused on, four key industries in Oregon, one being early childhood education. The way that I see this position kind of supporting these compensation barriers is like what was mentioned before, just around awareness. I think that the early childhood education issues that are coming up directly influence the other workforce challenges that I experience and I see all over the state. So I know that access to childcare is important, but also training those folks and compensating those folks that do that type of work is also important, right? So I think that the interplay between all the other industries that I'm focused on, but also early childhood education and access to early childcare is incredible, and it's needed. Board for legislative support. So if we wanted to write a recommendation for legislation, we could potentially ask the Workforce Talent and Development Board for their support as well, and that could make its way to the decision makers. Um, and I think that some of the help that I can get and help provide to people is maybe through grant funding or grant searching. Right now, there's not, to my knowledge, right now, I don't currently have a grant related to early childhood education assigned to me, but the heck is a huge place, right? And so who knows, maybe this Kelly Zink, I'm very new. So let me also preface this with I've been in this job for 3 weeks.
Oh, wow.
So yeah, and so it's a lot to digest, and a lot of people to know, right? Even within my own organization. So I'm digesting that, as well as doing my best to, advocate and understand what the needs really are as related to early childhood education, but also my other industries.
Thank you, Jennifer. Welcome.
Can I add something Jennifer just brought up that was what I noticed, which was missing in here in the compensation is our childcare workers also need childcare.
Yeah.
And that is forgotten a lot of the times and it's not reflected in here. I've had wonderful employees leave because they couldn't afford, they had 3 kids under 5 and needed childcare. And so they went to a program that could give them tuition assistance. And over, I've had great candidates who then withdraw their application because I can't provide them with the tuition free or with any sort of assistance with their childcare. So childcare for the childcare industry is a huge issue. So just thank you for reminding that, Jennifer, that this is just as much important here. So again, since the huge majority of providers are actually women and women with young children.
And just to be clear, so at your organization currently, you cannot provide tuition assistance or child care support across the early childhood age group?
Well, we serve just preschool, so we have Preschool Promise and Preschool for All, but the childcare needs for the staff is huge.
Yeah. Okay.
If they can't be there because they have their own childcare needs, like you don't have childcare, so that's or preschool.
Yeah. Carmen, would you like to share?
Yeah. So I'm really like resonating with a lot of what is being said. I think that so as a workforce development board, we are currently, we have target sectors that we work with, such as manufacturing, clean energy, construction. And so we are working on behalf of employers and businesses. But one of the sectors that we're working in is also early childhood education. So we're kind of coming at ACE from a couple different directions. But one thing that is so important, I think, is that we can offer is helping and like raising voices and advocating for the fact that childcare is part of our infrastructure. It's a crucial component of the economy. It is a service for children and families. Yes, and like that is dear to me, that all children have quality early learning experiences. But on top of that, it is also part of our economy and our infrastructure. And part of the work that we can do is really elevating the voices of business owners, big and small, in terms of the needs that Leora just called out, that it is not possible for people to be at work and be part of the economy if they have children and don't have childcare. So that and we can't have childcare for those employers if people are not compensated at a rate that allows them to enter and stay in the field. So in terms of that everyone having access and having a functional economy, like, I think that's part of the work that we can do. And I think also just being part of the work in advocating and in finding common language that we can all use to talk about these things, right? So people are receiving these same messages like over and over and over again, because it's complicated.
And then Marcella, do you want to speak at all from representative's perspective?
Sure.
And then also your own within.
At the legislative level, as some people have mentioned, putting together good policy, the role that we play is to often coordinate with all different groups, similar to what we're doing today, and move those policies forward, of course, advocate for the most robust funding and the most supportive policies that we can, and make the case to the colleagues, Rep. Miron's colleagues. And so it's a role of I feel that it's a lot of coordinating as far as, bringing the expert voices to the legislature and to expose those policies and to the committees that need to make the decisions. So. And then re-ask and re-ask. You don't have to write that part down.
Yeah, can re-ask. I do it. Okay, is there anyone in our group that I missed?
I was just trying to look back.
Yeah. I think we're all here.
Oh, no, I was gonna add some value to my
Do you want to
statement.
see what you said?
Yeah.
All right, we're there. Go, Robin.
Sorry about that. We have many, you said grants of owners. So I'm gonna say we have many, hold on just one moment.
Yeah. We have, let's see, grants. I was still warming up my typing skills for owners of African American. Largely. We can come back when Robin can come back to this piece of it. I think the next part of this conversation is sort of, it's like your role, and then the next piece is like, who are your key partners in this work? So what are the key partners or collaborations that you or your organization would need to advance this work? So thinking through the lens of compensation, thinking through the lens of what are those barriers to compensation. So who are the partners and collaborators that you would need to advance? And we're really starting to look at recommendations, and that means things that are changing too. So thinking about the things that would need to change. Who are those partners or collaborators that you are working with around compensation and addressing the barriers? And also, if you need to take a minute to write some notes and then join in, that's also great. Yeah.
Um, I can start if you'd like.
Yeah.
Um, yeah, so in my kind of unique role, I work with the Workforce Talent and Development Board, which is a consortia of many employers around the state. I also have access to the local workforce development boards, which is where one of them is which where Carmen works currently. Um, and also the employers related. So I go to a lot of conferences, talking to a lot of employers, connecting them to the local boards. But also, it would be nice to connect them to other employers who were doing employer-sponsored childcare to maybe develop a practice or community of practice about how to make that work for some people, or maybe a co-op or something. I also am on a lot of different associations for other industries, the other key areas I focus on. And, as we go through this, one of the two main workforce barriers for all the other industries are childcare access and transportation. And those other associations also have opinions on access to childcare, being a huge part of why they can't retain workers. And it's just a huge barrier to these gigantic corporations as well as smaller associations. So those are for me are the partners that I can kind of help loop in.
Do you want to name those partners again? Just that I make sure I have it.
Sure.
Yeah.
Yeah. So there's different associations for specific industries, and there's a lot of those. Like I have a whole spreadsheet of just those. Um, but also employers, the Workforce Talent and Development Board. If you want to make it smaller, you can do WTDB.
WTBD.
Yes. Oh no, BD. The other way. Sorry.
Workforce Talent and Development Board. There we go.
Thank you.
Ah.
And then the local workforce talent and development boards, of which there are 9 in Oregon.
And also for full clarification, I have not worked really closely on this study, so I connected, but so there will be places where there's just big gaps that have just because I'm here to facilitate and haven't been part of this big process. Okay. All right. Thank you so much, Jennifer. Who would like to go next?
I can go next. When it comes to, like obviously other funders, I mentioned that earlier, like how can we all get on the same page with things? But what's really great in my role at the foundation is I get to partner with lovely folks like all of you who do this work and are really great at it. And so looking for opportunities to fund projects that allow us to speak with one voice. Like Carmen, you mentioned that in the previous response. And I'm super excited that one of those collaborations that's coming out or debuting just this week at the Working Together conference in Central Oregon. And with the support of a ton of great partners, there'll be a launch of an employer toolkit. So helping employers understand how they could kind of get into this childcare game, support their employees with simple things like having flexible work schedules or all the way to very complex, opening up their own childcare program. But it's just trying to create guides or help folks talk again with one voice. So like finding ways for us all to kind of speak to the different audiences and different sectors. Jennifer, you were, alluding to that. And then again, figuring how we can talk in a way that helps everyone have a common understanding, know that we're, talking about the same things, and then support the work. So if you all come across any of those projects that kind of fit that bill, let me know. Oh, very cool. You'll see the employer toolkit there.
Yay.
Hi, I can go ahead and speak again. So as a small nonprofit, pulled in many, many directions, and it's hard to be there. So first, I would really want to appreciate like Children's Institute and the other people that are able to coordinate with them to get the voices out there. But key partners are political leaders and others, people in the education system, people who have the ability to make the changes and make the recommendations and push on it and get the data out there and the information out there, as well as our government funders are kind of key to this. One of the things that I know that Preschool for All has done, we're not able to benefit from it right now ourselves because we don't serve infants and toddlers, but they added on for programs that had their preschool some funds, a subsidy, an additional subsidy if you had infants or toddlers in your slot, because the reality is we can't get the wages up unless we get the income up to run the programs, because the programs are very expensive to run and very complex. The requirements are very, very complex, especially since they're not always cross-linked. So there's just that reality of running preschools and childcares in the state of Oregon is an expensive, complex work world. And so thinking through like, how do we do that? How do we increase the subsidy, whether it's looking at a statewide for a policy that could be that there's a flat subsidy that goes to providers that are working with kids per kids. We have to get the money up in order to get the money to the staff, because it's either on the parents and the costs are already crazy, or it's on government or other funders. So like somehow we have to figure that out. And then the other part is the barriers into getting actual news sites open is super, super complex. We're trying to do that, and it's a full-time job to try to do that, as well as other things. And one of the key parties we need in that conversation is we need the city permitting offices, because the requirements for an e-occupancy and to do that are very, very complex and costly. And there aren't very many buildings you can actually operate a daycare in or a childcare center. So there's all sorts of things, and they really need to go through and look at all little details to figure it out. We were very lucky in that we had an Encore Fellow with us last year, which was a retired Intel executive, and her two roles were to figure out professional development and figure out Oro. And then another one is to look at all the requirements from our different funders and the licensing. And she was like, this was the most complex project she worked on. And she was a high-level executive at Intel. So I'm just working internationally. So I'm just saying it's not an easy lift. And also get some education out to a lot of the other foundations, like thank you, Dana, for being here, around that there is still money that is needed within the system, that it's not covered. And sometimes local foundations think it's covered because we have Preschool for All and we have Preschool Promise.
I wanted to clarify one of your points. So you started, you were sharing about the additional subsidy that was available for programs that do infant and toddlers. And then you were talking about programs being expensive and complex to run. My assumption here is that you mean early childhood in general are expensive, not just the infant and toddlers. So it's just, okay.
Right. Running early childhood education is expensive. from infants up till K age, right? It's a complex world.
Mhm. Okay.
And there's staffing requirements and all sorts of other specifics. So what I was saying with Preschool for All is if you are a Preschool for All provider, you have a pilot site, and your site also includes infants and toddlers you don't get Preschool for All money for, there's a specific subsidy allocation per slot. And that's what I'm talking about, is looking at that as kind of a potential model across the state system of how to get money out there to the providers so that tuition and costs don't keep going up for families, and that staff can actually get paid a livable wage. It doesn't have to be an all or nothing way of doing business where it's 100% covered or partially. You know, there's other options.
And I got that right, that it's like having those additional funding streams that's the key piece of it, not the fact that they
Right.
wanted to add build onto the age group, but that it's like they also offer.
Right. Right. But if you look at, like, if you're talking infants and toddlers specifically, there's even less resources. Like Baby Promise doesn't have enough slots, and the ERDC program doesn't have enough funding. So there's huge gaps in funding.
Mhm. Great. Thank you.
This is Jessica. I can share, so at the local level in Washington County, again, it kind of goes back to similar to what Carmen was saying, and Dana is really trying to build that shared messaging and understanding. And so really working with our local partners, and those individuals being like our early learning hub. And then kind of more outside of like childcare experts is really thinking about how do we bring in industry leaders and economic development practitioners into the conversation. And so in April, this past April, we held the first ever Washington County Childcare Forum that brought together these different sectors together to have this message. And it was the first time we've done that in our region. Really trying to build a baseline of understanding of what is the childcare landscape and identify opportunities for collaboration. And probably shocking to no one in this room, compensation is one of the things that rose to the top when we think about barriers, and does show up, and try to elevate this. You know, I think for many of us, we continue to bring the story forward of we want to do better around early childhood because that's what's best for children. But when we think about trying to bring in the business side, we have to kind of tell a different story there, is what it's felt like, and talk about similar to what was already shared here about the impact to other industries. You know, often the barrier that their experience is childcare. So it's a shared problem, and how can we come together to collaborate on that? And so I'm very lucky that we have had conversations and brought in our county people to the conversation, city people, to talk about some of the barriers, and maybe it doesn't directly haven't gotten to compensation, but kind of the things that may impact that. Some of the things that was mentioned about like zoning and permitting, and how do we get to that? Because it may not be directly compensation, but it's on the pathway to thinking about that, right? If we can reduce that, people can expand their businesses, have multiple locations, which could likely increase the opportunity for them to be profitable and increase wages, right? So it may not, at face value, it may not seem directly like compensation, but to me, it leads to that, and ties in there. And then at the state level, I think it's important. So much of what happens, I think, in early childhood can feel disjointed and siloed. And so when we start talking about compensation, the partners that need to be there in our early learning system is, you know, really all the key players in the early learning and care system. So of course, Department of Early Learning and Care needs to be at the table in the conversation. And how do we leverage what has already happened, like models that they've used? I know this was mentioned in the report, but preschool promise, how can we leverage things that they have been able to do around compensation, and what lessons have we learned, what works and doesn't work, and how do we kind of use that instead of starting from scratch? And I could list all of the millions of acronyms that we know of our early childhood system partners, but I think it's just really important that everybody's involved in that conversation and doesn't happen in isolation, because again, initially it may not seem like there's a connection, but it's like, Oregon Center for Career Development, like they don't necessarily have a direct tie to compensation, but that's where the Oregon Registry lives, and oftentimes compensation is going to be tied to for someone's professional development. So just making sure that people that, again, may not initially feel like they need to be a part of the conversation, but as we think about how our system is so interconnected, they really do need to be at the table. And so I know Melissa taking notes is crazy, so I won't throw all the acronyms out. Happy to drop them in the chat, but really just, I guess, if you want specifics, I can do that, but just making sure that those partners are at the table, because again, I think that doesn't always happen, and from what I've seen in our system.
Indeed. If I can just jump in and second what Jessica just said, that is exactly it. Coordinating all the expertise that's out there and making sure that we're really looking in a deep way at all of the pieces that are affected is such an important work at the state level, so that policy is really vetted to do what the intended, to do what it's intended. And that is always better served with more people at the table, I think. So just want to second that exactly. And all the different people and the acronyms. Agreed. There's so many. But certainly DELC and the state agency folks, but it really goes a lot deeper than that, as you just mentioned. So thanks for naming all that.
Okay. And has anyone not had a chance to share for this question? I'm going and looking back at my. Robin, do you have are you able to share? I think she had to step away for a second. Join us back when she can. And then I think everyone else had a chance to share, correct?
Melissa, I can jump in. Oh, sorry. Go ahead, Alina.
Thank you. Sorry.
I'll go before you, Alina, because I feel like mine is like copying and pasting Jessica's also. Yeah, I mean, we work with same partners, and we're in a lot of some of the same meetings really around this topic. Certainly economic development offices, both locally and across in the state level. The other workforce development boards are crucial partners. All of the CCR&R and their leadership, the early learning hubs as leaders in the field. Other partners that we have that are important are also, we have employer sector panels. And those are people that are business leaders and owners who are very engaged in supporting and having voice in workforce development in their own sector, for their own business world. And those can be really great partners, I think, too, for us as we increase our work in early childhood ed around advocating for childcare.
And then Elena.
Yeah, I was going to echo a lot of what Jessica and others have mentioned as well. The other piece that I was listening for is, I know Leora mentioned this earlier, of just health benefits and insurance, retirement benefits, and also thinking about health partners, how we get everyone covered. Like it's not like direct compensation, but it's part of the compensation package. And getting childcare providers categorically eligible for other childcare opportunities and things like that.
there anything, before we switch topics, is there anything from the report that we are sort of missing? Any of the barriers that we haven't had a chance? I haven't, that anybody wants to speak to. So it's like cost of living adjustments, regional disparities, educators of color. We've mentioned it, but is there anything specific? Because we're talking, this report is sort of focused on specific barriers as well. If there's anything that needed to be said that hasn't been said through that lens.
I could add to that. From a small provider viewpoint, there's very few resources out there for providers to set up smart, thoughtful, legal salary structures. And so if there was information of like best practices and recommendations and examples and things like that, that would also really help a lot of the small providers of knowing what to do and how to do it, that in itself is a barrier. My impression is a huge percentage of the smaller organizations are people that were educators and just moved up to try to take on this role. And so they haven't been able to get that information, and it's hard to get as professional HR practices.
Right. Okay, thank you.
I would totally agree with Lenora. That is some of the struggles that some of my providers are having. And then because they are so inundated with the work that they can't come out of that piece if they're really a small child care provider.
I think what Robin also is talking about too is that, and I think also what we were just talking about as far as benefits go, is the emotional and mental health support for those who, you know, may be experiencing burnout. Having those resources available is really important, but that's just not something that we've mentioned, but we've kind of talked around it a little bit, and talking about access to quality benefits, and talking about maybe some disparities for smaller businesses, where if you have smaller business, you may have smaller staff amounts, which may contribute to more mental health burnout. If you don't have, you know, a strong bench to come in, you know, so to speak, and sub in for people. Not that I know an incredible amount of how that works. And listening to you all, that's what I've heard a little bit. And I also want to talk a little bit about rural access. When I recently went to Eastern Oregon and talking to their workforce development board out there, it appears that it's incredibly difficult to get childcare, so much so that people are not seeking other employment that they may be qualified for, because they are, you know, taking care of their children because of the lack of access. And the cost prohibited, you know, the cost prohibitive of saying, okay, I could work a month, but I could pay that whole month in childcare, you know, as opposed to saving my wages. So I might as well not have a job, and, you know, provide my child quality care that I know is good because I'm doing it. Anyway, that rant is over. Apologies.
Right. Right. So now we're moving into resources, and we'll spend about 20 minutes on this conversation as well, where we get all the time that we need. The conversation is flowing at the right pace. So what are the key resources that you or your organization, institution, or program would need to advance this work? So let's take a minute to think about it, and then we will all share.
I can go ahead and go because
Please, Robin, thank you.
I feel like I was a little bit absent for the conversation. Now I'm back in it.
Good.
Some of the key resources we would need is additional grants and funding to fill in for the gaps. What we've been doing is we are a part of the Seating Justice Grant, but in addition, we've been trying to piece together additional resources to support the work of the African and African American childcare providers, because of access or awareness. We haven't been some of those groups have been not in certain conversations to access or gain support in like the infrastructure grant that was out recently, and then other pieces in terms of targeting and marketing, to having them be a part of the conversation. And so I'm going to always say money, but then awareness and then access. And what we would do is we've been providing technical assistance and support of their businesses. What that looks like is if they needed one of the providers is doing their backyard, redoing their backyard because of this grant, the support. We've been doing like neurodiversity training to support different works as they are supporting their children in care that traditionally wouldn't have gained that support. So we're doing a lot of cool things, but again, you need funding to support the work that you're doing, and then supporting that. So.
Yeah. Also, I think something that I haven't heard a lot about might be sort of a different resource to kind of talk about is sort of evaluation of what has been effective so that we can promote those programs and iterate that. That's something that's like an investment in tracking what's happening like in preschool for all in Multnomah County, like that is part of what's going on, is being paid for by the county, but that's only one piece. So like when we're developing career pathways and supporting things like adequate compensation, having a system that will allow us to understand what actually moved the needle for people. So it's like if we do see increased retention, being able to say like what factors were at play in that.
And just to piggyback on Carmen's idea, also something that captures like the common pitfalls that, you know, funders or anyone who's making an investment, the state has could gain from, you know, again, things that have happened in Oregon or things that are national too, like being able to outline at times, I think the things that folks gravitate to really easily, but don't move the needle. And we've already established that, yet sometimes we find ourselves right back there again. Like, I don't know, top 10 pitfalls. Like you can't just build it and assume they will come. That doesn't work. Stop doing that. Like different, you know, different things that we all can laugh at, but inevitably we're going to find ourselves there at another point in time. So like, again, promising evaluation practices and things that we've established that we know to be true. So stop doing it.
Do you want to name more of those? Since this is one of those forums where these things get compiled.
Well, I would look to all the brilliant folks in this room, but more and more in my mind, I'm starting to wonder if we should get to a place where if things aren't directly tied to somehow getting money into the pockets of educators, and Jessica did a great example of like even zoning ultimately does do that, but like if you can't make that connection, even if it's a little bit of a windy path, I'm seriously questioning if we should be doing it.
Be doing what?
making any investments in Oregon, either public or private, that can't somehow be tied back to compensation. Like some things, again, seem like good ideas, but I wonder, like to Carmen's point, like, is that really moving the needle? Is that just doing something so that we look like we're being helpful? And funders, we're guilty of that all the time. But it isn't actually something that is meaningful to the folks that are most directly, doing the work in the system.
As in having mandated pay levels?
That's one way to do it, but it's easy to say that and then like leave somebody with like well, how are you actually going to achieve it? So like things that don't, again, like help providers directly, like, if we were doing improvements and renovations to facilities, like perfect. Then for a home-based provider who doesn't earn enough money to replace the flooring or, renovate her backyard or improve her facility in whatever way she wants, like that's a great way to get money into her home, into her hands in one way or another. Like it's not compensation, it's definitely not retirement benefits, but it's something like if we can't make a tie back to money to humans, like I don't know, like I just wonder if it's all for nothing. Jessica, I've seen you shaking your head. Like, what are you thinking? Like, does it make sense? Do you
It does.
disagree?
It does. And I've been trying to think of examples that are what you're saying, Dana, and I'm trying to think of them, but I mean, even I would argue even ones that feel like really good intention, like that word directly, sometimes can be harmful too, right? Like I think about the workforce retention payment program currently, and there's been a lot of excitement around that for educators, but there's no long-term plan for that, right? So it's like it's great, right? It's also been very delayed. I know that providers have been needing that money for a long time, but I mean, it's great that it happened, but what's the long-term plan? Is it going to be more detrimental when this goes away of like, we threw money at the early educators as a system, and now we think, oh, we threw them $500 retention bonuses. We did our part, check, moving on, right? And I'm not saying that this is this group, right? But like the larger society and systems thinking like we threw money at it, that should fix it, right? And it's like, wow, $500 retention payment, like that is nothing, right? And then I think maybe what I'm thinking about with what you're saying, it circles back to what I said of like not having everybody at the table when decision making was happening, because as the resource and referral, the work that we do in our place in the system is we're providing that technical assistance of support for individuals to apply for this. And that's the thing. There's an application, which I understand why that needs to happen, but then there's all these barriers that come into play. So when we think about when I think about the original question of building a more like equitable system of compensation, I can just say that this has not been equitable. And we'll see that. We already see that in the data for this specific example. And we can tie that to the barriers that were in place. So I think that that's part of the story when we think about, again, maybe it's not direct compensation, but these things that are being done, that ultimately it's money in the pockets of early educators. But again, is it really being equitable? Were things thought about? If I want to get really specific with the retention payment, the platform in which you have to use, because you have to apply and then you have to do something. Providers get a email back, and it's PaymentWorks is the platform within PSU. It's only in English. So when we think about our workforce in Oregon, right, I could go into so much more detail, but like those are the kinds of things that come up and come to mind. So I don't think it's exactly what you're naming, Dina. I can't think of a specific one, but I think it kind of just it highlights when we think about compensation. I think a lot of what's been done, I think it goes back to what you were saying, Dana and Carmen, is having an analysis of, has it really moved the needle, and what do we know about it? Because I think it will be interesting to see that, given what's historically happened in our state or in other states.
So kind of thinking of like outside where there's resources, it can really make a big difference. So first off, paid leave Oregon, huge benefit, huge benefit. It's made a difference in our staff being able to stay when they got pregnant, when there was other things that happened. So that was a huge, huge thing, very helpful for our field. And looking at other opportunities like that. So another thing that comes to mind for us is, speaking of language, interpreters. Like, so if there was another source that paid for and gave us real access to interpreters, that would help not just our staff, but our children and our students. In our small little school, it's over 10 different languages across our school. And there's many of the languages that the children speak are not languages we can get any interpreters for. And so that is a huge issue in quality of education. How do you, and making sure, like, is there a way to bring that service to the different providers and have those interpreters available, paid for out of another pocket that then is a resource. Same thing with special educational needs. We have a large number of children that have delays and disabilities, and post-COVID, it's a different world. And, last year I tried to bring in and find money to pay for a staff to do special education, but that's not sustainable around kind of what is the reality. So how do we bring more and more of that expertise, again, because our teachers want to, it's their pay is one thing, but they also need to feel like they can really do high quality care and education or childcare. So looking at those resources, or how do we get them into systems for affordable healthcare? Because as a small organization, I mean, I had to fight to get a change in our health insurance plan in the middle of COVID to be a zero deductible, so my staff could actually access healthcare. So again, like figuring out how to help with that. I couldn't get EAP because we were too small. And, there's all those sorts of things that come into play. So if there's a way to broker some of the access into different benefits, I know that some other systems within Oregon of providers have done that, but a way to broker those affordable key benefits to help offset the costs would really be really helpful so looking at all those sorts of things, or whether it's, another way to offset the cost is to offset the cost of the building that you have to operate and run in. So looking at all the different ways of what are the real cost centers and what are we trying to achieve, and how are the different ways that we can get there without making it so complex that heads are exploding, and people can't access. Over 50% of our staff are their first language is not English. And so that what you're talking about of trying to do that thing, there were several of them that said, well, I was denied from this and they didn't know how and they needed help to get through it. And so that's a big deal. And it's also, let me also say, if we also did a survey of finding out how many of our child care and early childhood education providers actually have regular access to a laptop or an iPad, they are trying to do trainings using their phones. So, that's just not okay. Like, we need to figure out how do we get some of those resources into the hands of all the providers, because how are they supposed to apply for all these things? How are they supposed to navigate oral when they're just using a phone? And there's also language barriers. But there's lots of opportunities. So that's the good part.
Robin, I saw your hand up a while back. Did you want to say a little more?
No, I just had contractors come in. That's why I'm off screen. So I'm sorry, you guys, but I'll pop in when I can.
Okay, sounds
Okay.
good.
The other thing that I was thinking about as folks were talking was just the conversation around pay parity and the research that has been done and still kind of, we may not know all the gaps yet, but the home visiting coordination folks, the Coves, just came out with some data around the difference in home visitor pay and how that is different within
childcare pay and different within nurse home visitors and, you know, all these different sectors within early childhood education. And just thinking about how that creates competition within early childhood, and the danger that that causes within our system, and thinking about how we compensate folks appropriately, regardless of language, of race, of ethnicity. Everyone is getting what they actually need. Rural versus urban, like all the factors that go into it.
Elena, do you want to share what was the takeaway from that research? That there is a pay parity, like in what direction? Do you want to just summarize it if you could?
I mean, I wouldn't like quote me specifically on this, but I think one of the things that stuck out to me was BIPOC home visitors make less. And I think that was the thing that stuck out to me the most, is that even within home visitors that make less than other sectors in early childhood, you have that, yeah, BIPOC educators are just making even less.
Okay. Other perspectives in this. So thinking about the key resources your organization would need. So we've heard from Robin, Carmen, Dana, Leora, and Jessica, and Elena. I think Marcella, if you want to chime in. I think you are the only one who hasn't had a chance in this round.
I don't know if I have anything to add to this section. I've really been learning from from the people who are more on the ground about what some of these barriers are. So thank you everybody for sharing.
That's the resource they would need. Okay, and then did I do a good job? Did I miss anybody else? Apologies if I did. Not intentional. Okay, so now we're segmenting to the last, we're transitioning to the last two pieces of it. So this is really starting to think about the policy changes that are needed. We'll spend about 20 minutes on that, and then it'll be 10 minutes coming together and sort of, again, like looking at what are the main recommendations that come from this group based on this conversation that we've had. All right, so thinking about what are the policies that would need to change in order to make the changes that are needed happen. So we've heard about a bunch of different ones so far. Zoning is like an example of something that comes to mind. So thinking about in the work that you do, what would need to change or what it might look like for you to be able to address or help support equitable compensation policies. We can go ahead and take a couple minutes, write some notes, and then come back together too.
I'm pretty open to being pretty vulnerable here in that, I am not the expert in the room, and I know that there are other state agencies like DELC and things that have been brought up in this group already. Like, maybe there's best practices that DELC already has for what's working and what's not working. It would be nice to have a report on what's working and what's not working, as opposed to 10 different reports that are just research based. It would be nice if they could be consolidated and more succinct guidance about what might be helpful for people. I know small business owners, I come from a long line of small business owners, they don't always have time to sit and read an 85-page report. So, and I know that that's kind of high level, but
Good.
it would be nice to have, really specific best practices created. But at the same time, for my own position, have specific workforce investments that were, funded for career pathways, or even, to remove some of these other barriers to early childhood education, like, waiving fees for, a setup. I don't know. I'm just basing off of what you all are saying. Um, Remove some of the the red tape about like, not necessarily the licensure of the staff, but the, like, zoning or whatever, or maybe subsidize uh the building costs, like was mentioned before. And maybe that's an investment. I don't know. But removing some of these ulterior things so that people can focus on early childhood education and focus on doing that well, instead of having all of these miscellaneous pieces kind of out there that are harder to manage.
So when I think of the policies that I hope could have the greatest impact, I think one is obviously COLAs really need to be prioritized for those different funding entities, and not the first thing to get cut. When looking at those increases, I think looking at options to expand access, like, is there, getting the the businesses involved in what could be an easy structure that they could use to help provide some sort of subsidy for employees, so that they could help with that, versus just that, that pre-tax sort of plan, but something where they could actually provide some funding to their employees, but it would be a very easy system for them to do. Looking at the ideas of how to add that subsidy per child slot across the system, similar to what Preschool for All does. And then obviously, I'll just say it, looking at the option of looking at the Preschool for All model as a statewide model, and slowing it down enough to spend the first few years on focusing on creating the capacity to actually add new centers and sites. And that means looking at how do you have to build the infrastructure ahead of time. You have to have a timeline that makes sense, that providers and programs and organizations could actually create childhood centers and family care and programs to serve kids, but in a timeline that works. I mean, it's just very challenging. We end up having to plan to pay lease costs for 10 months to a year before we can ever even have kids in there. And how many organizations can afford that?
Mm.
And it's getting rid of those. The siting issue is the biggest issue for a barrier getting a place. You have to, and these centers are very different. You have to, you need little toilets. They're not like most buildings cannot be a child care center. They're just, to toddlers and little kids need access to toilets right now. Like they cannot, you can't just have a staff that sits in a hall that escorts them up and down. That's just not a good way of doing things.
Carmen or Elena, would you like to speak?
I mean, if I'm dreaming big, then kind of universal care, right? And knowing like the billions of dollars that it'll take to accomplish that. Thinking of like, how do we build up to that? So I mean, specifically to compensation, thinking about the COLA and also how that fits into ERDC. Because I know some of the unions advocate for it, but I don't know how that plays with ERDC subsidies for providers. That's something I need to learn more about, but also, yeah, just ensuring that providers have access to health benefits, regardless of who their employer is, retirement, I mean, ideally getting everyone a living wage or higher, but I don't know if we'll get that funded this year.
I like it. I like that.
Okay, Jessica.
I ditto what Elena says. I mean, if we're dreaming big, I know that's not likely what we're going to get, but I'm hoping that we're taking steps towards, even if they feel small. I'd love to eventually see compensation that for our early childhood workforce that's pay on par with what K-12 teachers receive. So, and when I say that, I mean not just the actual like check, but similar to what Elena said, that they have, robust healthcare access, that they have a retirement, they have vacation and sick time and professional development time, and a system that allows them to access such things, meaning they need a substitute system, which I know there's the beginnings of that happening in our state, but I know it's not meeting the need that we have. And so it's not just enough that our educators have that benefit, but they need to be able to use it. So you could throw that at them, but if they don't have a system for someone to come in and run their childcare for them or cover the classroom, it doesn't really make sense or work. So I know all that takes lots of money. And again, I know it's not going to happen overnight, but if we're dreaming big, that's where I would really like to see policy move.
This is me being dense. When you say universal care, like universal child care is what.
Yeah, which in my mind includes infant, toddler, all the way up to age 5.
Okay.
And I think that most of us, like what we kind of understand is that is we can't get to a K through 12 standard of pay and benefits unless, I mean, the reason K through 12 has that is it's a public funded source, and we have for decades thought K through 12 is free to families. So unless you go universal, you can't really expect a system of providers to do that when so many of them are in their family or different programs and they don't have any of that resource coming. I mean, that's in order to get to that equity of being like K through 12, you have to shift to these things are all covered. So otherwise it's pretty hard to attain as much as you try. And I think the risk is as small providers and others, when we step forward and try to get our salaries really high and our benefits really high and those costs go up and the pay doesn't, we're going to lose more providers and more daycares and more preschool programs, and more of them are going to close because you're not going to be able to keep affording it. It's a risky thing to do, like what I have done, which is 89% of our budget is for that. So it's, we have to, I hope we can figure this out. Because I'm hearing of a fair amount of providers that are closing. That's not good.
Robin or Dana, would you like to share?
This is Dana. I can go. Sorry, my home internet dropped, so I joined back up on my phone. So
welcome back.
Apologies. Yeah, apologies there. Thank you, Nelda, for popping me back into the breakout room.
Sure.
I would just like to follow up and say, like, yeah, how do I vote for Elena and Jessica? Like, I completely endorse their plans of looking at Birth to Thrive education just as a right for children, which will ultimately, again, benefit all the educators in the system. So kudos and seconds to everything that they said, and anyone else who I missed while I was in and out of Zoom worlds.
Are there any pieces, so from hearing this, sort of seeing what you want to aim towards, are there smaller pieces that you there along the way that we haven't mentioned in this section of the conversation that would need to be there? We talked about the COLA. We talked about having best practices, reports that are succinct, knowing sort of what works and what doesn't work. Waiving fees, removing red tape, not around licensing, but around zoning, subsidizing building costs, site issues.
The only other one that's jumping out to me that we've missed is really shifting ERDC from the market price study to the cost of quality. So again, really, and it's true for the whole system and all of the work that's done, like looking at what the cost it takes to cover the work of educating our youngest children and compensating providers at that rate, as opposed to what burden families can tolerate. And so shifting all of our compensation models to really covering the true costs of care.
Yeah, Dina, that is right in line. What I was gonna add is, as policy, moving away from such a focus on the federal poverty line to a more realistic view of wages and required income. So using a living wage calculator of some type.
I think adding to that, cost of care and making sure that things like benefits and retirement is factored into that cost of care for the providers.
And that, Alina, that is part of what you just named, is part of the reason that I say like some type of living wage calculator, because the living wage calculator that I have seen most prevalently out of MIT doesn't include saving for retirement, which is certainly lacking in my opinion.
Carmen, do you want to say a little bit more about what it would mean? Like, and again, like I'm not an expert in this field, so go ahead and unpack it a little bit more for me. what you're saying about moving away from a focus on the federal poverty line. Like who's
Yeah, well, and policy wise, a lot of what the conversation at the state around like how we measure whether or not like someone is doing okay financially, or if a family has a like quote unquote need for childcare subsidy, is based on a amount of income that is just outdated and inaccurate in terms of how well someone is actually doing financially. And so something like an actual living wage calculator takes into account far more factors and paints a much more realistic view of what someone needs to earn as an early childhood educator. And it paints a much more accurate view of the other side of it, of families, right? Of like what a parent needs to make and how much of their percentage of what the percentage looks like of their income is going to childcare.
And then it's, sort of the simple, more families qualify for these programs have more support. Right?
Yeah. Like if you're using the outdated way that we measure someone's financial stability tells us that childcare providers are making enough money that like they should be fine with what they're making, and they're clearly not. And honestly, they're often making an amount of money that people who are saying that they're doing fine and are using those measures would not accept as a wage for their work.
Robin, would you like to share some of the policy changes that would be needed?
I would totally agree with Carmen in terms of the having families being approved at a realistic rate. It would be ideal to use or become in alignment as suggested before was the universal child care model, where that would alleviate some sorry, I have contractors and I know they're about to make a noise in a few seconds, so I'm just trying to gather my thoughts to alleviate the pressures of having people be recognized for their what they make, and then also because of their family responsibilities may have something, they don't take in consideration a mortgage or the living pieces that are outside. It's just mostly about what they bring in and not taking consideration what is necessary and needed to live. In addition, I want to go back to, I'm going back to the top. I'm sorry.
You're good.
What owners need. Owners need, as they are trying to meet the needs of the state, there's bigger requirements, it's more zoning, and so they are getting caught up on some of the challenges of trying to accommodate the care. So they may be in a family child care, and then they're, they may have the possibility of going into a commercial building and then not knowing or the city's zoning practice and all that, and having an advocate to kind of walk through that process is taxing tasking, and they're unable to support, they're like kind of in this influx. It's like, I'm doing childcare and I'm doing it well, but then I'm trying to expand, and there is a growth level that doesn't come right away. And I don't know how we can. I know there's certain groups that help with that, but it's a bigger deal, and then to get folks ready for that. So there's some challenges around that too. Not to mention, in terms of training, the cultural piece and awareness. Some of my in our group, we have 7 to 8 African languages that we are working with and trying to do TNA support for that. And then in addition, some of these women who are doing childcare have the challenges of not being able to, get access to information in various ways to meet their needs. So there is a barrier for language. There is a barrier for access and information. So I guess that's what I would want to add.
Thank you. Okay. Clean up my notes here a little bit. All right, so we've heard.
Thing, Melissa, I'm sorry.
Please.
So I know, I think, I piggybacked off Elena and had like the big picture dream, but thinking more about a short-term strategy, I know I shared lots of barriers around the workforce retention program, but I think in a short-term strategy, seeing ongoing investment for that to be, as we work towards, we know it's not going to happen overnight, unfortunately, that we get to that universal care. In the short term, how can we have renewed investment in that? So ongoing investment into that, and I'd love to see it not only just renewed at the same level, but continued growth, increasing those amounts. At the same time, how do we evaluate and think about, is the place that lives in the process, is there opportunities for that to be revamped? So not just continue to throw money at it, but evaluating if there's an opportunity to eliminate some of those barriers that we addressed earlier so that it is accessible and equitable, and actually is getting in the hands of our early educators. So that's, again, I mentioned the dream, but I know that in the interim, like, how can we still work towards that? And that's something that was been invested in, but again, because it was CARES Act dollars, there's not a plan for ongoing investment, no plan for these payments to exist long term.
Okay, so thank you so much.
One more thing that I'll add to the short term that was mentioned earlier is making sure that childcare providers, anyone in ECE, has access to childcare. So making them categorically eligible for childcare.
Can you say a little bit more about what that means?
Yeah, so I mean, I'm thinking about like preschool like some of the state funded opportunities through like Head Start, state preschool promise, ERDC, and there are different folks that are categorically eligible, which means that they're automatically eligible to participate in those programs. And some of them are like children experiencing houselessness or DV or our foster children. Actually, I don't know if DV is one of them. Take that back. But yeah, making sure that childcare, like folks that are working in childcare and early care, are part of that eligible group. That it could also, I mean, it's also considered a recruitment and retention strategy.
Mm-hmm. Okay. So we'll spend the last 10 minutes. I think it's actually closer to 12:20, I think is when we transition. Yeah, so the last 10 minutes doing sort of our key policy recommendations you would have for DILC and policy makers to make these change happen. So we've talked about a lot of things, and the important here is to like take a couple of minutes and think through what are the 3 main things that you need to see change, that you want to recommend changes, to make sure that we have as a group sort of named what is the most important pieces of it in order to get to those sort of concise and succinct set of recommendations. That is the task. You could take a couple minutes and sort of think about what would be your 1, 2 key things that you would recommend. You could have it in the same way if there are things that you don't recommend. If you think there's a wrong direction, name the wrong direction.
So one potential thing is to, currently we have a variety of programs that pay for 100% of the cost. So fully tuition free versus subsidies, and maybe look at the different models that we have available and what are the different pros and cons, and kind of assess those, because there are families that could pay a little bit, and that would potentially expand access. But I think I wouldn't want to move on that until it's been like kind of evaluated of how that really plays out and as far as access and use. And I think but I mean, to look at all the different ways in which we can provide more families with support, and also ways that we can get increases in salaries up for the childcare workers in a very consistent, stable way. So COLAs to me are super important, as well as looking at other ways we can leverage system resources. So like, for example, if like childcare, like if childcare workers have children and are paying $1,200, $1,500, $2,000 a month for their own childcare, that's a huge issue. Typically a benefit package for an employee is about $1,000 a month for a full robust benefit package. So again, what are the ways in which there could be leverage and access through some sort of broker or relationship with the state to be able to help supplement the different ways that childcare workers need their expenses that they need? What can we do that is financially feasible and sustainable for the long haul, and can make a stronger system versus make it a complex system? So trying to keep it as simple as possible, but also sustainable.
Mm-hmm.
The only other thing I could think of is there may be some cost analysis benefit when we look at some of the requirements for childcare and early childhood education providers, are there some requirements that are maybe not that essential that actually end up costing a fair amount, and not spending a huge amount of time on that, but there may be a few that come to mind that can reduce the spending of a provider and be able to pass that on to their staff.
Do you want to name 1 or 2?
I can name one.
There you
And
go.
cost of insurance. That's kind of been paralyzing some providers in terms of offering, if they're meeting the state requirements. If they are doing some public funding, they have to have those certain levels that may be debilitating if they don't have that initial funding to support the work of what they're supposed to do to meet the requirements of the state contract that they just signed, or even the preschool for all, or those are that is detrimental. I do agree with the COLA and being able to figure out our plan for how to bring salaries up. As I would love to give salaries or initial salaries up as people are going through certain steps, but it's been harder and harder to get certain step elevations if providers or if providers or staff is not wanting to go through college as a resource and wanting to do community training. That's been kind of an issue. And then even the readiness for college courses have been debilitate, because you have to get up to a certain level. And so that's been hard to kind of undertake for some folks that may have a language barrier and not having access to language to support the work that they're doing.
Okay, we have about 4 more minutes together, so.
This is what Dana said earlier, but I would love to see policy move forward of us moving from market price study to the true cost of care measure. I think that would make a big difference in the conversations we're having and the work we're trying to do, is starting from a place of understanding the true cost of care versus using what are providers charging. And I think Elena said this, like, what's the burden, like what is the cost that parents can shoulder, and we really need to understand what is the true cost of care, of providing quality childcare.
Okay. Yeah, and this will feel, I mean, it'll be a repetition of what you've said before, but just like, what are those main, of everything you've said and thought about, what is the main thing to make sure that you want to pass forward?
But I think what we're still missing in here is how do we get the salaries up for people and for programs that are not government funded? So it's like getting those salaries up for the people doing all this same work, but there's no government funding source. Like, how do we do that? How do we get the larger care system so that no matter where you're employed, if you're doing this work, you have a reasonable pay and good benefits? And you can continue to do this, because we're not going to get everything to universal in the short time. Hopefully we will at some point, but what are the strategies that we can do to make that a reality for those workers?
Yeah, that's what I was gonna bring in. It's just a state-sponsored benefits package for early care providers.
Okay, Carmen, do you have any last thoughts? Dana.
Yeah, I mean, state-sponsored benefit package for ECE workers, and using the true cost of living and care in conversation. And again, I think talking about early childhood education as the component of infrastructure that it is.
And then Dana?
Yeah, the only thing that I would add to this great list in I think everyone's been saying it all along, but making sure that whatever policies we adopt in the future to help us move the needle, it always values Oregon's mixed delivery system. So home-based providers as well as center-based care. I just wouldn't want to like miss out the fact that the spectrum of providers or the spectrum of educators doesn't the facility that they're in doesn't matter. They're all educators, and we need to make sure that we're compensating all of them in a way that recognizes their value.
Right. I think they're going to bounce us over, and there'll be a final sort of wrap up all together across groups. I think we'll come back together. I think it'll be potentially many of the same ones of us. I'm not totally sure how they'll do breakout rooms, but there'll be the follow-up afternoon conversation as well that will look at another facet. Yeah.
So, we have the Oregon Saves program, but that is something that potentially there could be created so that providers, there's automatic money that is put into their retirement plan. I mean, I've been lucky to get 100% of our employees involved and participating in our retirement plan. And I did a 403B, so I have pre-tax and post-tax. So if we can get Oregon Safe to be pre-tax and post-tax, and then really give contributions, because all these folks are going to be struggling when they're older. And we need them not to be. This is important work that they do. Can I clarify? There's nothing that's automatic now in Oregon Save, so it could be a tool that we could do to start providing, if you're a childcare worker, that there is something set up for you and money is put into it. Currently, it's a choice, and no employer money is allowed to be put into Oregon Saves. So one of the problems with Oregon Saves is it's the only across the system retirement plan. And as an employer, you can't put any money into it. Only the employee can. And so that needs to change, and it needs to include a pre-tax option, and it needs to include potentially a contribution by the state for child care workers, that they are getting some contribution regularly. So it really builds up. Because right now it's not very effective.
Thank you. Thank you. All right, let me see if I got letting Nelda know that we're done.
While we're waiting
Yeah.
and to move, I just want to say, Melissa, you are amazing. Look at this pacing that you did. This was great. Good job. I just want to say not everybody has those facilitation skills, but you're doing great. And I wanted to just spend this time to say thank you.
Oh, how kind. I really appreciate that. I don't get to do this part of the work enough. I'm behind the scenes too often, so I really appreciate that. Thank you so much. And yes. Yeah, I wonder if I can just push us all back to the main room. It's sort of the hope. Maybe I can close it and then that'll automatically bring us back. All right, we're going to try this. It's an experiment. I'm going to leave the breakout room.
Supposed to be around. Hi, hello. Okay, so I was just telling the rest of the group that we had some troubles with the pre-assignment of participants in each breakout room. So that's why some of you were not automatically assigned here, but here we are. As we mentioned, we will be discussing these aspects, and I just want to know, were you able to review the document, the PDF that we sent, the slide deck about the findings of the primary research or secondary and primary research? Okay, thank you. And if not, we'll take like a few minutes just in case someone needs to review that. Hi, Laura, welcome. Thank you. Nice to meet you. And I think 3, 6. There are a couple of more people who are already in the main room that are supposed to be here. So we'll just wait for them. So let me share my screen and then we can start with introductions and making sure we have the right name, position, and all that. Are you able to see my screen? Can you watch it? Yeah. Okay, thanks. So we're gonna start with these brief introductions, and I just want to make sure that you are here and that I have this information correct. So as I was mentioning, I'm Sergio. I use he, him pronouns or él in Spanish. I am a research associate at AB Cultural Drivers, which is one of our research partners in this process for this project. And I would like to please ask you to introduce yourself with the same information, name, pronouns, if you feel comfortable, organization, what's your role? And I will ask, as I see you in my screen, so Casey, can you please start?
Yes, my name is Cassie Hulse, and I am the director of OCCD. My pronouns are she and her, and I'm new in the role. I just started in August, and I came from Alaska, so most of my experience and perspective, is largely probably going to be, coming from there.
Thank you. Nice to meet you. Welcome, Cassie. Thank you so much. I have Heather next.
Hello, my name is Heather Irwin, and I'm also from OCCD. I am the registry coordinator, so I support programs like the STEPS, or also known as the Career Lattice, and ORO, and credentialing and education awards.
Thank you. Thank you so much. Welcome. I next have Delina.
Good morning, everybody. My name is Delina Binyam. I use she, her pronouns, and I am the advocacy manager for Family Forward. And we are an advocacy organization that represents a lot of caregivers, providers, moms, parents in general, and continuous advocacy for equitable childcare. And I will be having my camera off. My Wi-Fi sucks, so I really want to be able to stay engaged. So I'm here, just camera off.
That's fine. Thank you. Thank you so much, Delina. Claudia.
Hi, everyone. Buenos dias. My name is Claudia Rodriguez. I am a program manager at the Marion Polk Early Learning Hub. My pronouns are she, her, ella, and we are an organization that works with just local providers, organizations here in the community on trying to better service children in the ages of 0 to 5.
Thank you so much. Sam?
Hi, I'm Sam Morelli. My pronouns are she, her. I'm from OCCD, and I'm the program manager of the Workforce Recognition Bonus Payment Program. New to OCCD, but worked in the field for the past 13 years in after-school programming.
Thank you so much. And as you can see, our group was assigned according to our roles. So your roles. So I think this is going to be very, very interesting in terms of registry and competencies. Thank you. Tanya.
Hi, I'm Tanya Henry. I work for Oregon State University in the Family Resource Center, and I'm the director of Campus Early Care and Education, oversee all of our early care and education centers.
Who's next? Dana?
Good morning, Dana Hepper, she, her pronouns. I'm the Director of Policy and Advocacy at the Children's Institute. I'm going to duck off for 15 minutes at 11 to meet with the legislator, and then I'll be right back. Here till 11.
And Laura.
Thank you. Good morning. My name's Laura Pilkington. My pronouns are she, her, hers. I work for the Oregon Child Development Coalition, which is a statewide nonprofit that serves children and families. The children are ages birth to 5. I don't know about the ages of the families. And my role is that I support people who are earning their Child Development Associate credential. And I also am a professional development specialist for the Council for Professional Recognition, so I can do verification visits for teachers. And that's pretty much it. I guess I should say I work in over 30 sites around the state.
Is there anyone missing from these introductions? I believe there were more people assigned to a room there, but
I was just assigned recently.
all right. Thank you. Welcome. We're
Thank you.
just sharing names, organizations, and roles.
Excellent. Thank you. My name is Brandy Starbird, and I'm the Early Childhood Services Manager at the Native American Youth and Family Center. And I also am the director and oversee our Early Head Start program.
Sorry, was Early Childhood Services Manager? Was that the role?
Yep. Mm-hmm.
At Naya, right?
Yep.
All right. Thank you so much. Welcome. And anyone else? And we might still be receiving some participants to our little group. So if that happens, I will just ask their names and roles to fill out this form. And I believe two of these people were there, but well, let's see what happens. So, well, we can start. I were just asking about the previous materials, the previously sent materials. We sent you a PDF that's a summarized version of the report, of the findings of the report. So that will be our main input for the final report, which will be delivered after this meetings that we're having. And most of you said you actually did have time to review that. We will be having 10 minutes because we already took some time with this reassigning. So we will have a 10-minute break or time to review the findings. Here is the link. I'll just put it again in the chat in case anyone needs it. And if not, you can just take a quick break or have something to drink or buy a break or whatever. And then we'll be back at 10:41. Is that all right? So we'll have the pages. Let me just, I have it here on my screen. Let me just share the, no, it's not here. No, never mind. But I have my report open, so the pages for us to review are there. Let me just open it so we can see exactly how the the pages are those are in the index as well. So it's from page compensation, competencies classification and registry. It's number 2 in the link, and it's on from page 20. It's from page 20 to 25 in the documents. So that's what we need to review. If you need that time, and if not, we'll see you in about 8 minutes left, 9 minutes here. Feel free to turn off your camera if you need to, or we can stay here. And if you have any questions, I'm here as well. Thank you.
Sergio, did you say that you put it in the chat there?
I was going to, and it didn't. There it is.
Awesome, thank you. I was just searching my email.
Yes. Yeah, I know. It's there just exactly for that reason. All right, so we can start getting back. And I just saw a comment in the chat. Let me just see it. Is there any more context for the DHS finding? Okay, let me just explain. My role here is just a note taker. So I'll be just like taking the notes and adding here. That's what I'm sharing my screen with you. So you can see my notes and maybe correct if anything is wrong there or anything like that. And we will also be analyzing all our transcripts from this meeting, so we can have that notes correct. But from the program, from the research findings, I know and I have some context, but not all of that. So I'm Dana, can you please tell me what were you referring to in terms of DHS?
Yeah, one of the primary research findings was inconsistent support from DHS. Participants noted the lack of support from the Department of Human Services, feeling the system prioritized families over educators. I just wasn't, since ERDC moved over to the Department of Early Learning and Care, I wasn't sure if this was like historical comment or if this was like currently.
Okay, so the results from those findings were from listening sessions that were held the last 2 months. So the comments are recent, yeah. All the listening sessions were between August and September, yeah. So we're gonna start. We sent you a first question that was over email, and we have most of that responses. So we will not be discussing that, but we asked you about your role and what was the role of, like, in your position or in your organization or program or institution in, perpetuating these findings, and in what ways your role or your position or your organization will be able to address these findings and promote some changes. So we already have that information, and if not, please, you can communicate by email or just look for that email when we ask that question. So, but it's not our objective to be discussing that here. So we're gonna start with this question number 2, which is, what is the key role that you or your organization could undertake in continue to support the advancement of the system towards more equitable, responsive, and accessible practices to improve the needs of the workforce? So who wants to start? Please. I don't see if I don't see any hand raised. So I don't know, Dana, since you were already
Yeah,
yeah,
I'm
and
happy
then
to
Laura.
jump in, and then Laura, go ahead.
Yeah.
So the Children's Institute does convene an early childhood coalition. So that's a space where organizations can take proposals that they would like to see move in the legislature. And we can definitely support that process and make it as easy as possible to ask the Early Childhood Coalition to support proposed changes. And then we work pretty closely with state legislators and the governor's office on early childhood issues. And so if there are ways that we can be supportive in terms of, helping those legislators understand the issues, make space in committee hearings, get meetings on the calendar, we are glad to support those efforts to work directly with elected officials. I was similarly with DELC, we work really closely with Department of Early Learning and Care teams. Two.
Right, and as I mentioned, I will just review and make sure notes are correct. So don't worry about if I don't get all the information. I will cross-check this with the transcript. Um, thank you, Dana. Laura.
Yes, thank you. I think I can't speak for the whole organization because I don't feel like I have that type of position of power here. But I do think that my role and perhaps my department's role, we could offer support as far as technical assistance goes when there will be changes moving to competencies. I think explaining that concept and offering support to early childhood educators in the field will be critical. And also I work with staff at the Oregon Registry somewhat regularly. And so continuing that work and advocating for educators in the field and also, well, I think continuing just to offer the technical assistance that is needed to navigate the Oregon Registry. And one thing that the organization does that I think that I could say safely the organization would continue to do is to ensure that the early childhood educators with whom we work, both OCDC staff and partners, have the technology that they need in order to be successful. That still is an underlying issue, and that's something that we are still working on. But I feel like OCDC does a very good job of supporting people with technology.
So the technical assistance is related to technology, right? It's one of the
Technology and also just like how the Oregon registry system works. What are the expectations? Getting people enrolled in ORO, getting people's prior learning experiences evaluated and into ORO, helping people upload documents. I do a lot of that type of technical assistance. And reminding people to apply for an Oregon registry step and help, all of those types of things. My coworker who has a similar position to me, we do that work.
All right.
Mhm.
Thank you so much. Who else wants to fill in about how your institution can work in these terms? I have here Tanya. Would you like to add anything? Well, you're on mute. Thanks.
I'm not sure if this really answers the question, but OSU provides high quality opportunities for real life work experience in our centers, and we are partnering with local high schools to create those workforce pathways. So those that are in community colleges, in four-year universities, as well as high schools, to create some high quality real life work experiences. I don't know if that's really falls in that same category, but
Yeah, sure. Okay, thank you so much. Next in the screen is Brandy.
Hi, yeah. Oh, pardon me. I'm sorry, I'm a little sick today, so I'm I'm kind of having to mute to cough, but yeah, so Laura actually works with our organization. We partner with OCDC, and she has supported and is supporting several of our aides that have come to teachers. We have recently found that it is more productive for our organization to kind of hire from the community with people with lived experience and less formal experience, and then try to provide that training. And so based after, and we haven't quite done this yet because we're just getting the funds, but based on the program that Laura does where they offer CDA support for people that are working for us with through OCDC. So the CDA is the Child Development Associates Certificate, which is, recognized as a teaching credential as well nationally. And so we've just procured some funds um, to start a program for non-OCDC folks so that we can start training and providing these educational opportunities for, our new workforce. We're opening an early learning center next year, which will be larger than what we have now. And so we're hoping to kind of get that training, get a head start on that, and be able to support community members, high school members, families maybe that have kiddos in the early learning classrooms, whoever, from our community or who wants to work with our community that is interested that may not have had the opportunity to get that education or training. Yeah.
Thank you. Sam, are you there?
I am here. Sorry, let me get my camera on. I think I would rather default to Heather, who I work with at OCCD. I I work in our workforce recognition payment program, so kind of my biggest piece lately has just been helping people get signed up at Oro and get employment up verified and updated. That's been a lot of what we've been working with providers and providers who don't come from a licensed background, and just kind of helping them find connections to the registry. So that's kind of been the big piece that I've been working on.
Well, hi, this is Cassie. This might be an opportunity for Sam, Heather, and I to just kind of piggyback together. So we're with Oregon Center for Career Development, OCCD. Most commonly, people recognize us as ORO, the Oregon Registry Online. Give you a moment to catch up your typing.
No, it's fine, it's fine.
And so at OCCD, we have the registry is one service. We have training approval. So we have a variety of services to support the workforce and help with the systems, scholarships, the workforce recognition awards that Sam was just talking about. We're collaborating with career and technical education, CTEs. We're actively working on some registry revisions, which was part of one of the documents that was attached as part of the pre-reading, the NWRA, the National Workforce Registry Alliance recommendations. So using those recommendations to how we can improve the registry and our organization. And some of that work that's happening right now with that is we're going to be launching a survey soon and doing some in-person feedback sessions. And the goal of the survey and these feedback sessions is to get feedback directly from the workforce and from our partners and from those, to find out what's working well, what are some of the areas that they identify that we can improve on to help influence those registry revisions.
And who's next? Or let me see here in the screen. Heather.
Cassie covered most of it. Some of the things we're doing are we're trying to align our registry revisions with national trends and other states. So we've been doing research with other states associated with NWRA to find out their processes and systems and what pieces would add value to our system. We're also looking at our credentials and how to better include them and incorporate them into the state systems. We're going to be hopefully partnering with community colleges and seeing if there's a way to include experience into the credit for prior learning so people can start getting some recognition for their experience. And we're also looking at how we can incorporate the competencies into the registry moving forward as those changes become in place as well. We're also taking a look at how we can include things like coaching and communities of practice. So we're trying to take a more holistic approach to instead of just doing training and education, looking at professional development as a whole.
I'm sorry, I just received a note from the main room. So
Oh, okay.
I was not able like to have
Oh, that's okay.
but I will update that in the notes. Thank you.
Okay, not a problem.
Thanks. So this was taking more a holistic approach to professional was it
Professional development instead
development.
of just training.
Perfect. And who else? Claudia, would you like to go next?
Sure. I think about the work of the early learning hubs and really strengthening our relationship that we have with the CCRNRs, the Child Care Resource and Referral Centers, that work more directly with providers, and really thinking about what are the opportunities that do exist for educators currently and making sure that that information is translated down to educators so them knowing what exists in a way that is getting communicated down to them. So we currently have a lot of our postings take place on Basecamp on things that are taking place in the community, but really listening more to are there like, and I don't know if Oro does this or not, but Oro 101s or things that really our providers are needing assistance with. So are there things that we can be creating to help meet some of those gaps with navigation and other things that exist? Also connecting individuals who are interested in small business startups with locations like Primeros Pasos who have like cohorts that are designed to assist individuals from the beginning forward.
Right. And Delina, I think
Yeah, I can talk very briefly. We're very similar to the Children's Institute in a way where we continue to have relationships with folks in the state legislature, as well as continuous relationships with the Department of Early Learning and Care. We also there's also the Child Care for Oregon Coalition, which there are a lot of organizations that are a part of where we really center parents and providers as well as educators in the childcare space when it comes to overall advocacy and policy setting. And then I would also say, just from our organization's perspective, just continuous working with entities and coalitions that continue to do the work. For example, we have been working very closely with OCCD when it comes to the child care worker bonus checks, as well as being a part of statewide apprenticeship and workforce coalitions. And I would also say our base building, continuously getting in touch with the community, whether they are providers or educators. We have many different spaces that we house that kind of allow them to be either the voice that we reach out to when it comes to making sure that our advocacy really is centered around their experiences, or giving out information in ways that we can continue to empower those folks um, in those types of spaces. If that makes any sense at all. I'm sorry. I'm
Of
still
course.
one cup of coffee in.
No, that's perfect. Thank you. That's a lot. Thank you, thank you, thank you. All right. Is anything else that you would like to add in terms of the different efforts and how your institutions or organizations could improve the workforce environment in the state? And we, of course, can go back later, but for this first question, would anyone like to add anything else? And I know not everything is on my notes, but it will be later when I review and cross-check the transcript. All right, if no one's missing and we have everything there, then we would like to go deeper into what will be the key partners or key collaborations that your organizations will need to help advance this work. And I know most of you already mentioned how you work closely with the CCRNRs or the OCTC and other partners and collaborations. But would you like to add anything else about this? Who will be, and ideally, what would those be if they are not there at this moment? I don't know if anyone wants to start. Do you have any ideas about key partners or collaborations that are essential for advancing this work?
I think a coalition that comes off to bat. Oh, I'm so sorry, Laura. I just saw that you raised your hand. I'm sorry. Um, but the CCR&R Directors Coalition is one that immediately comes to mind just because they are oftentimes like, well, at least from an advocacy standpoint, um, our eyes like into like some of the key like this like what's working and what's not working on a systemic level for childcare providers and educators. And so um yeah, that was just one that immediately came to mind.
Perfect. That's great. Thank you. Laura?
Yes, I think that this is not a new idea. This has been floated around a while, but I'm thinking that somehow, if like when people are hired into early learning environments in Oregon from other states, particularly like Idaho or California, um, some type of education on site about how their prior learning experiences will be transferred into the Oregon registry system, like ongoing education about that for people so that they really understand how um, their work experiences in the past are going to be valued as they work in a new state. And I know that that's been talked about before. And also, I think somehow our organization does have staff from OCCD come do technical assistance sometimes. So I think continuing that relationship and collaboration will be really helpful.
Okay. That was continuing the relationship with
OCCD. When staff sometimes come and do technical assistance sessions, but figuring out maybe how to do that more for people and making sure that it's bilingual. Those presentations are offered in at least English and Spanish.
Anyone else? Is there any other ideas about collaborations or key partners, in addition to the ones you already mentioned in the first question? Are there any other ideas? Or if you want, we can start adding also to the next question, which that's about key resources. And it's similar but not the same, because we're not asking for specific organizations or positions, but about resources. What type of resources will be used or needed, or would be really a game changer if you could have those? Or what are the resources that you're currently using that are helping in advancing with these goals? You can talk about either question here.
I think that for the number 3, it could be if OSU could partner with, so is OCCD, is that Oro, is that what I heard some of you guys say? Is that the same? Okay. To partner with OCCD to allow for some type of credit for high school interns, maybe to help them with a step. So maybe some kind of partnership with that we could work together on that and helping people get higher up in a step.
Okay. You mentioned high school interns, or was that another term?
Yeah, an intern. So we have an internship program, and we have university, community college, and high school are all part of that. So it wouldn't just be for high school, I guess. It would be for everybody, but allowing some kind of acknowledgement in the STEP system for participating in that.
Okay, that's great. Thank you. Any other ideas about collaborations or partnerships? And we can talk about what's been working and it is like a best practice or a great way about collaboration that you already mentioned some of that, or also what would be needed that it's not there yet. And the same for the resources. What are you currently using that it's a valuable resource, or what would those look like? And remember, we're using all this information and what you're providing to the discussion to build up the recommendations for the report. So that's why we're asking this specific questions. Is there anything else about partnerships, resources, what works, what would be needed?
This is Cassie. I can just say, being new to Oregon, I'm still identifying who the partners are and who the stakeholders are, and getting oriented myself. And so, every time I attend like a CCR directors meeting or, something, I'm learning. So this is really helpful and interesting to hear what others think are those partnerships.
All right, thank you.
This is Laura. I think one thing that is working as far as a resource it is actually myself and my coworker, like having the people power in an organization to be able to support staff in being able to navigate the systems. And also, I think it's helpful because I feel very comfortable reaching out and asking for help and saying, oh, I know this person, I'm going to call this person, I'm going to email this person. And sometimes when the people with whom I'm working don't feel empowered in that same way. And so I think I know the idea is to empower others to be able to self-advocate, but yet sometimes people don't feel comfortable. So having somebody who can do that until they grow into being able to do that for themselves, I think is helpful and a very important resource to think about, because this is a very people-centered business. And so you need people to help people, really. A chatbot is not a good idea.
Perfect.
Well, yes, I agree with Laura about the importance of people and relationships. And I mean, the chatbot is new idea is not a good idea. Is just because there's so much individualization. I don't know why that word, of course, in my head sounded right, but not when you say it out loud. The nuance to a specific situation, and you can't apply something a lot of times directly across the board because their situation is different, their work environment's different, the training or experience they have is different. Wait, let me try again. Individualization. Got it.
All right. What else? What other key resources would you say are important? And here what might work for the rest of the group is like to think about what are the things or different resources that you're currently using that have been helpful. And perhaps those are like the common normal things for you and your work or your organizations, but might not be what others are using. So maybe just maybe that's I don't know, repetitive for you or pretty obvious from your standpoint, but maybe it's not for everyone. So just this exercise of recollecting what's been useful. And maybe that could bring us to what will be needed to help advance the work. Is there anything else there? I don't know if there are hands. Okay, no. So I don't see that. And Cassie, when you were talking about this individualization, would that look like more customized experiences or a diverse range of opportunities, or how would that individualization look like?
Yeah, I mean, just how Laura was saying, the helping people navigate the system. What works for one person is not necessarily going to work for another. Somebody you might be able to say, go to this give them a couple steps, go to this website, click here and get into here, and they're good. Then other people are going to need, you to actually walk them through, okay, click here, not enter here. So it's really going to vary on the individual. Maybe in this instance, this example, I'm giving their computer and technology skills. And so it's trying to being flexible enough to provide it in a variety of modalities to support a wide range of people, but at the same time, using the resources, the staff and the resources that you have, what can you reasonably accommodate?
Sergio, I have a question.
Sure.
Hoping you can provide a little bit more clarity on, and I might have missed it, on what you mean when you say advance this work. Just because all of us do come from different locations, have different ways of approaching this work. So when we're specifically looking at the competencies and just registries, are we assuming that we're all working towards a similar goal of wanting to get more people within the Oregon registry system and process through that, or wanting to look more at like competency-based work, or what exactly are we wanting to define here?
It refers to the findings and how the workforce that we were able to have in our listening sessions are, and remember those were folks from different regions in the state, and they had these challenges or difficulties, or were um, telling about their own experiences, and that's in a way reflected in the finding summary. And that's like, how can we, from your different um, locations and positions and the work that each of your organizations does, how can we support that or contribute to those challenges? And it's, we recognize that those are not the same for everyone, as um, Casey was just saying. But yeah, so it's not specifically that we want everyone to have the same experience, but in a way to advance in this system. And if not, I mean, if you have a more critical perspective, or you have some other ideas about the registry and the way it works and how it's related to competencies, that's also fine to report in this group. Yeah. And I'm not sure if that was clear or not, but it's like a broad sense of how, from you, the work that you do or your organization does, or the relationships among institutions and organizations, can we all contribute to improve these aspects of the workforce. And also, if that's important or not, if you think that's not important, or maybe there are more urgent issues. I mean, we have another table about compensation, and there in the afternoon we'll talk about the career pathways and the professional development and all that. That in terms of competencies and the registry, yeah, that would be the idea. So I have here Laura and then Dana.
Yes, so I really don't have a strong understanding of what a competency model of the Oregon Registry System would look like because I haven't seen it. So I don't have a draft to model my comments on. But I think currently the Oregon Child Development Coalition pays for people to receive their professional development. So they pay for staff to earn their child development associate credential, and they pay for staff to earn an associate's degree. And they also help staff earn bachelor's and master's degrees. And so when you look at the current model, as people move up in steps, there are many pathways, but really the quickest and most efficient way is for people to earn formalized education degrees. And so I do think that that is one thing that is working in the current model, that the Oregon Child Development System is helping staff function within the Oregon Registry System because they are eliminating the cost barrier of getting a higher education, which then moves them up. And in the current model, I guess gives them more professional status in the field.
Right. Thank you. Dana?
I sorry to hop back on and miss a little bit, but just reading these comments, I think for us, you know, we can support partner organizations in navigating like the political system piece of the puzzle. And what we need is like to know what you think and a way to communicate with you, and understanding how it works best for the folks that are like in these systems that are using our you know, Oro or like competency pilots or whatever. Just a way to communicate for us to understand your experience so that we can support good advocacy for improvements.
Sure. Perfect. what else? What else would be important or is important in terms of resources to be able to support the workforce? Thank you, Brandy. Should be back. All right. Are there any other key resources that you think are important? And if not, we can move on to the policies. The next question would be what policy or policies, changes in policy or policies will be needed to make the changes happen, or what needs to improve. And when we talk about policy, it's not just the legislative, like the law. We're also talking about maybe internal policies, or more community policies, or different sets of rules and norms that might help improve the workforce environment and these changes. So it also includes the political, high profile policies, but also internal and more everyday policies. Do you have any ideas on what changes or new policies would be needed to improve? And while we think about policies, we can also address the final question, which are the key recommendations in terms of policies for DELC and for policymakers. So this, as you feel free to contribute to both questions. What are the changes in policies, and what will be the key recommendations for the department and for policymakers and stakeholders, for these changes? From your experience, from the field, from the work you're doing, it could be related to competencies and registry, but also to a different aspect of the report. That's fine. Any ideas on changes that are needed in policy or policies? Or recommendations that you would like to see reflected on the final report or on actual changes in policies?
On question number 6, Oregon has had on the books for a while a early childhood workforce scholarship program. Like, it exists in statute, but the legislature's never put any money into it. And so one question I have is, like, that's obviously more seat time. It's not competency, right? So, like, do we still want money for that scholarship program, or should we let that lie? Because what we'd actually like is a more competency-based system. I'm curious, like, what people, or do we want both? We want the scholarship and we want to move toward competency-based system. I'm, curious what folks think.
Well, that brings up a question for me about, like, people become more competent not just through practical experience, but also through gaining intellectual experience. And so I'm wondering if it could be, to be a professional in the field, you do need to be able to know about certain theories and practices, just like any other field. There's a baseline of expectation. And so I would promote both. The other,
I agree that I absolutely agree. We need both. Thank you for saying that.
I also agree that it's both. It's kind of a yin and a yang. What came first, the chicken or the egg? I mean, both are very valuable to the development.
This comment, this is Laura. This comment, I would like to talk a little bit about Spark because, and I was recently at the Grand Articulation Summit, and I did read a little bit about the Spark updates, but I am not super current on exactly what's going on with the redesign. But I would, if it's going to be competency focused, I would highly encourage the policy or processes behind the redesign to be as inclusive as possible for the different educational paradigms that exist within the early learning system. And also, I would be curious to know if how Spark is going to be integrated with the rest of the system, the quality system for the state as DELC moves this process forward. So maybe is it going to still be linked to monetary incentives? Are there no longer going to be monetary incentives depending on the level of star you get? Those types of things.
Okay. Perfect. Thank you so much. Any other idea about these two different approaches or any recommendations? So including both seems like a strong recommendations from the group, both the higher education, formal recognition, and also the lived experience. That's a key recommendation from this group, and also getting clarity about how Spark will be integrated and if incentives will remain or not. All that. Any other ideas in these areas? Recommendations?
I mean, there were obviously a lot of comments in the research related to Oro just being like tricky to navigate. I mean, we've heard from folks, for example, you have to know yourself like when it's time to apply for the next step. It's not like you submit enough hours and you automatically get the next step, or you have to know like what fields of PD that you need the next step in, and it can be kind of confusing. So people might take a lot of PD, but if they haven't been like coached through exactly how to strategically take PD, they might be taking PD without actually advancing. So it definitely seems like an area of interest from the field and like digging into that. But, so I don't know. I don't use Oro, so I'm not familiar enough with the details to understand. I'm just trying to lift up what was stated in the research comments.
Yes, we have someone here at OCDC who actually helps people figure that out because it's so confusing. So again, that person-to-person support per person for the process works. I don't know how cost effective it is, if people are like trying to be like, well, let's make this a streamlined system and try to do it on the cheap, but it's not cheap. Working with people is not, it's not an inexpensive line item, I guess.
I think too, there is some disconnect in the services that OCCD offers to support Oro. We do provide people who can provide that one-on-one assistance for the steps in both English and Spanish. And I don't think a lot of people know about that. And, it's something that they do primarily. And I think it's really useful and helpful. I know that CCR&Rs also provide that one-on-one support for navigating Oro. So I think that it's more of helping people understand that those resources are available.
I wonder too, alongside of those navigation resources, though, like what kind of simplification opportunities are available.
I want to dig in more about this comment about simplification opportunities. From your experience working with providers and educators and the systems, what would be the main challenges for simplification? Because folks are always, and that applies for every environment. We're always all in for simplifying processes, and we know it's not that easy. Why would you think that is, or what would be the main challenges or barriers to be able to simplify processes and navigating systems and all that? Have any ideas?
One challenge that I've experienced with our teachers is the requirement that trainings need to be live in order to be accepted. So we've had certificates, that were uploaded that were denied because it wasn't a live training. Well, to be able to get teachers who are in program in day-to-day operations to be able to do live trainings is near impossible, especially in our workforce crisis that we're in right now. Like I'm in a center right now, and we're sorely understaffed today, with multiple people out sick. So that has been a huge barrier for us in trying to find trainings that would be accepted that are not live. All
right. Any other barrier? You might think of?
I mean, we've definitely, I think, continued to hear maybe not enough step 2 trainings in multiple languages and or set 2. And the process of becoming a master trainer is something we hear a lot about, that it's hard to become a master trainer. But again, I haven't become a master trainer, so I don't know. This is all just like communicating what we've heard from childcare providers.
Mhm. And we do hear these things as well from as a representative of OCCD, and these are the things that we're taking into consideration in our revisions process and looking at how we can reduce those challenges and improve the processes. So we are taking all that into consideration and continue with those listening sessions to hear more about what the needs are.
I think one of the challenges maybe to simplification is the fact that so many people are doing the same work in their silos. Um, so it it may help direct service wise, but it doesn't help system wise in a lot of ways.
Well, and a little bit more like what Heather was saying, yes, we're Oro OCCD, yes, we're looking at some revisions. We do want it to be accessible, user-friendly. However, some of that is these are the best practices or the standards, or how do we better communicate? And not just from my own organization, but other organizations, how do we better communicate why some of the things that we have in place are in place, so that we can all be on the same page and not just, oh, this is cumbersome or this is challenging or this is, but to better understand, oh, okay, I may not like it, but now at least I can, there's a justification.
I also have heard that people feel really busy. Like our jobs are completely full operating the current system. It's hard to carve out time to reimagine and then shift the system. That takes its own set of resources that may not be currently available. Like if you want to, let's say you wanted to allow people to submit their courses. I've heard this doesn't happen, but maybe it does happen. I may have out of date information, but submit the courses like by like, uploading a document to your file instead of like printing out a form and mailing it in, for example. That would take like, technological back end work to actually like write the code and create the website, blah, 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 which are resources we may not have in the system right now.
Mm-hmm.
That's a really good point. I think a lot of us are just trying to stay afloat and manage what we have. And so it's not that we don't necessarily can't imagine something different or want it to be different, but do you have the time to take care of that when you've got so many other, I say in air quotes, even though I'm not on camera, priorities?
Anything else on this line?
I think one more thing to add to challenges of simplification is that, like at OCCD, having come from being a provider to now working at OCCD, it is a small team that touches every document that comes through. Like everything is done by hand, it is verified. If people don't upload to their Oro account, then it is comes by paper and has to be scanned. And so there's this piece where it's a very small team handling thousands upon thousands of documents for the whole state. That makes it harder to simplify when everyone's kind of working at maximum speed to support providers. And I know as a former provider, I didn't realize that. I thought it was just one big organization. Why can't they get it done faster? And then in reality, I'm like, oh, there's a tiny handful of us doing this.
And to speak to just that further, that is such a barrier for providers when it takes 6 months or more to get your documents reviewed and accepted. So it's a huge impact on the field that it is such a small group doing this important work. We are currently waiting to promote somebody at one of our centers because she's waiting on her step. So she cannot get her promotion. So that's affecting her. She could end up leaving because, she's not getting the promotion in time. So these are real consequences of that system.
Yes, I'd like to just say timeliness, just to support this conversation that if you want to need another person to support it, the timeliness of things. And I also do understand that the staff is at OCCD is very small, and you have a lot to do. So it's not a judgment. It's just timeliness is an issue.
Right, we recognize that. In the couple months that I've been here, I hear that, we're behind the timeliness, but those priorities, are set, by our sponsor to focus on licensing, which pushes other people back. And yeah, so what I'm saying is, I guess this goes back to resources and whatnot, and having maybe the funds to build the infrastructure, to hire new staff, because the work continues to grow. There's no doubt about that. The workforce grows, the need grows, people are going to continue to have children, so need childcare in whatever form that looks like. And so having the systems have the infrastructure, not just to handle the now, but to look forward and manage the growth.
And any other ideas? There's funding to address all these challenges that are not minor. Any other ideas in terms of policy, what could be done, what other resources would be needed if we had a wish list? Then, yeah.
One other thing I've heard that some other states do is have a common way to award community college credit for prior experience. I know many of our community colleges do award credit for prior experience, but the process might be unique to each individual community college, and like the number of credits might be unique to each individual community college. Whereas some states have said, you know, you can earn 12 credits and this is the process, and they're good at any community college around the state. Like every college has the same process. And this is where I think sometimes in higher ed and early childhood and K-12 and maybe other things too, like our commitment to local control has its upsides, but also its downsides because it can create a really fractured system for people to navigate. And so if you got your credit over here at PCC and they gave you 12 credits, but then you switch over to taking classes at CCC or whatever, and they'll only give you 6. I mean, these are just made up numbers. You've now lost 6 credits in your path to, you know, a higher step level or whatever. So creating some consistency across systems. But the challenge there is like, that's not how we have made decisions. So it requires like a new decision-making structure and process to get something like that across the line.
Thank you. Thank you so much. Any other ideas, barriers?
Yeah, that kind of triggers me something I learned at the Grand Articulation Summit is, I believe it's Washington, that all of their community colleges, they've kind of universal prefix, course numbers, and to make it easier for that transferability. If you start classes at this school and then you move to another one, North Carolina, Dana is saying has that as well. That would be really, having those universal systems in place would be really helpful for the consistency.
Right. Anything else you'd like to add? Other ideas?
Well, I would just like to say, just in support of this conversation about consistency across early learning education systems, that whatever changes are happening, that the crosswalks that are in place, either for the Child Development Associate credential or the Montessori primary diploma, that those remain in the system, because some people, that's what their education is going to remain. And if you go to a competency-based system, I don't want the good work that a lot of people have done over the last 20 years to like fall through the cracks. You know.
Right. And you mentioned,
I think,
sorry, what
Well, the
are
Child Development Associate credential is recognized by community colleges at a certain credit amount that can transfer in, and I'd like that crosswalk to stay, and also the crosswalk with the Child Development Associate credential and the Oregon Registry system that's in place.
Yeah, okay. That's what I was asking
Yeah,
the
it's a
CCDA,
credential, Child Development Associate credential.
Yeah.
That it does have to be renewed, just like a public school teaching credential. So.
All right.
I think this might be like mostly addressed now, but the other thing we were hearing a lot about was foreign degree translation. So I got my bachelor's degree in early childhood or in K-12 education or whatever in Mexico or in Afghanistan or wherever, I have that degree and credential. But now I'm in the United States. And how do I get that recognized? And it had been that you had to be employed, like you couldn't start a home-based program that way. You had to be employed by a early childhood provider that could then like sponsor you to receive a scholarship to go through degree translation. I think now you can apply for the scholarship directly. And so it might be more of like, what is that process to apply and how easy is it and how often is it granted and how much money do we have available for that foreign degree translation pathway to your Oregon step.
Yes, that was one of the topics that it's covered in the career pathways and also in the higher education component of the research. And yeah, and what we found there, it's that most people who have foreign degrees or certifications or credentials are not even aware of the possibility of that happening. And those who have this shared idea about the process being very expensive, just for the reasons you mentioned, right? The translation and transcription and all that. And it's not always the case. And there are sources available, but yeah, those are not widespread. Like people don't have much knowledge about that. So yeah, that's an issue, of course. Thank you. Thank you for bringing it out. Yeah. And when you mentioned the scholarships I mean, not just for foreign degrees, but in general, like scholarships are also not well known. You know, the accessibility of those possibilities, like scholarships for different areas, especially those that are outside the Oro system, right? So there are other opportunities, and folks are not really into that, like they don't know those. And also, it's also a result of the different, the diversity within the system and the providers. So for Latin or providers of color and some of the rural areas, that's more difficult for them to be aware of those opportunities. Yeah, so that was part of the findings.
Yeah, so on the topic of scholarships, I can talk about the ones here at OCCD and what I've learned the last couple of months. I mean, the funds are being expended fairly quickly. So this might be an area where additional funding and support could be helpful. I know specifically the early learning degree pathways, ELDP, we've expended the money, but we did save some money for foreign degree translations and evaluations. And the hope is that will carry us through the rest of this fiscal year until June. But, it's just really unknown. Depends on how many applications come in. Another area I see for scholarships, through OCCDs, will pay the CDA application fee, the initial fee, but not the renewal fee. And I'm kind of curious why. Is that another area that could potentially support educators to keep their CDA and potentially keep them in the field if they didn't have to bear that responsibility themselves?
Right, all right. Thank you, Laura, for your message. I don't know if you're still here. Yeah. I'll put my email in the chat, just if you have any other ideas, or if on your way in traffic you think about something else that you'd like for us to add to the report, please feel free to reach out. You also have the contacts about from Kim Leonard or Nelda Reyes or Akasha in Fifth Element, and here's also my email in case you want to add something, you have other ideas. Thank you so much for your participation.
Another, I guess, idea on the scholarships, somebody's working on a degree or course credits and they're kind of counting on the money to be there. And then if it gets spent and it's not, that could derail them or pause them. And will they be able to get back on track when funding is available again next?
So more funding for those scholarships. All right. Any other recommendation or idea you can think of, or any other additional comment if you want to? It doesn't have to be related with the questions.
I
Just
was
comments.
Your barriers question, Sergio, was really helpful because I think one of the other challenges in Spark redesign is like, I feel like it's like a trigger phrase for me. That might be too strong of a word because I feel like I've worked in early childhood for just 11 years, and I feel like we've been redesigning Spark for like maybe 8 of those years or something. Like I've never noticed to have like a steady state, highly functioning in place, like consistent Spark. It feels like it's always under revision. And so one thing I think can be a barrier is like we're redesigning everything all at once, and yet everything is interconnected, which makes it hard for us to like land anything. I feel like so if we're redesigning like our professional support systems and redesigning Oro and redesigning Spark and redesigning, how we demonstrate competency and then and all these things are intertwined. It's hard for us to land any of the planes because everything's interconnected. And so then the person who's leading on this project talks to the person who's leading on this project and changes the direction of this project and changes the direction of this project. And then we're like, I don't know. It feels like sometimes we stay in redesign for a really long time. And I'm not saying we should get like stuck and stagnant. Yeah. I don't know if others experience that also. Or if it's just a perception, but not real.
That makes total sense. You know how everything is interrelated, and then also for changes to be able to be like really used. It's complicated, right? And then going from paper to the actual everyday systems and what's needed, yeah, that can be really complex. Totally. Is there anything that you feel we're missing in this opportunity to 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 talk and to discuss and to try to put these ideas or recommendations into the report? Anything else that we're missing in terms of compensation, registry, the system? Anything else you'd like to add? Or if you won't be able to join us for the evening meeting and you'd like to add any other comment or recommendation for all the other topics, you're also free to do it at this moment. That will stay in our notes and we can add that to the wider topic recommendations. So please let's use these final minutes to use this time to, if we have anything else to add in terms of the report, the findings, the other topics, or this classification, registry, and competencies part. Nothing else? Any other specific? Well, the other element that we haven't just mentioned in full is this element of diversity. You talked about how each experience is different for different providers and different educators and people in the workforce. The governor's office was also very focused on not assuming that all workforce are educators. And I think that was a very important issue as well for us in the when taking into account when developing the report. So the early childhood and care workforce is it's more complex and it has different profiles there and diversity. I don't know if there's anything else you'd like to add in terms of diversity and culturally appropriate trainings or opportunities and the differences among between the different regions of the state and all that. Is there anything else in that realm you would like to add or to think of in terms of policies, recommendations? Because that's another key element that we're looking at. I'm just gonna ask how we're doing in terms of time. So I think we'll soon we will be taken back into the main room, but I'm just asking that. So a little bit of summarizing and closing. You mentioned your different roles and your organizations, and how is it that you are working towards the support and the for the whole system like to be accessible. And very close to that was the collaborations that you're doing. And I know most of the answers to question number 3 were already in question number 2, since you mentioned a lot of your partnerships and associations and how you're working closely with different organizations. And then we talked about the resources, having this empowerment for people to be able to navigate the system and for colleagues and folks to be able to ask for help and feel that power. That's very important. The human part of the people to person, person to person support, and not so much the digital bot aspect of that, but more the interaction that's really valuable. How experiences are different and maybe needs also change and user experiences are different and we should adapt to that. The different skills people have in terms of technology, computers, language, and all that. The flexibility that it's needed to support different needs and accommodate those. And the model, it's focused on having this formal credentials and certifications and all that, and how will that be interacting with the competencies-based model, right? And also all the work that is being done to help navigating the political system and the importance for those organizations in having a clear communication to really understand what the workforce is needing in terms of political needs and the political system. And then we were talking about the main barriers for simplification and simplifying the process. And I think that was really useful because most of the challenges were identified there, right? In how the system is complex, how it's constantly being revised and the different systems, the need for a universal recognition system, and how that might have a really impactful result in someone's ability to improve their career pathway or even getting a raise or being promoted, and the importance of having more funding as well in terms of scholarships, the resources, how the size of the team in charge of reviewing all documents has also an impact in the timing of all the processes for recognition and steps. And I think those were like the most important things that we discussed. Also the foreign degree recognition systems and all the issues around scholarships, how people are not always aware. However, funding, it's not enough and it goes quickly. And this issue about always trying to redesign systems that are interrelated might be problematic and has this domino effect, among others. So is that, well, that's kind of the summarizing. We have about 3 to 4 minutes to go back to the main room. So if you don't have anything else to add, please take a small break. You can come back to the main room. And if you have anything else you'd like to add or to comment, I'm here. I'm taking the notes. So we'll take a small break, and then Nelda will be waiting for us back in the main room. Thank you so much.
Sergio, I'm sorry I had to hop off there. They also were having the Birth Through 5 literacy kickoff budget meeting at the same time. And those were the funds I was talking about. But if I could briefly add, because this is it, that these funds, we only have like 3/4 to spend. And so sometimes the funds not only come quickly, but we have to spend them really fast. And it's hard to build intentional programs that way, is something I would add about funding. So we get the funds kind of late, and then we have to spend them by June 30th, right? And
so that's super important in terms of policy, right? Like changing those policies.
Yeah, because sometimes we can get to it that quickly, but life happens at a slower pace, I think, than especially when you're trying to build from scratch, right? And so
yeah, we received your message. Thank you so much, and thank you for coming.
Thank you.
I hope that was useful. We're just having a small break, and then we will join Nelda in the main room to close.
Beautiful.
So yeah.
Thank you.
Thank you.
And yeah, sorry I had to hop off. My
No,
boss was
thank you.
texting
So
me,
much
are you
for being
coming to
here.
this?
Thank you. Thank you so much for coming back.
Recording. Here we go. And to start with, I would like for each of you to introduce yourselves. You can mention your name, your role, the organization you work with, and your pronouns if you would like to. Anybody would like to start?
Start. I'm here, I'm listening, I'm just grabbing coffee, so you don't see all the kitchen.
Okay.
My camera will be off. But Abigail Mendez, I work. Do you want to do the intro again, Viviana? Sorry, I see that Teresa just jumped on.
Okay. Hi, my name is Viviana, and I will be facilitating the discussion, but I will not be participating in it. I will be taking notes and showing you the questions. And right now we're doing our introductions. I am with AB Cultural Drivers, and my pronouns are she and hers. And ella. Okay, so who would like to introduce themselves first? Abigail?
I can go first. Yeah. Abigail Mendez. Hi, everyone. I work at Latino Network. My pronouns are ella, she, her. I'm associate director of our early learning program. So I oversee, I do more administrative stuff for the 6 different programs that we have at Latino Network in the Multnomah County area, some programming in Washington County, and some in Clackamas.
Thank you, Abigail. Welcome. Anybody else? Teresa, would you like to introduce yourself?
Sure, I'm Teresa Martinez, and I'm from Eastern Oregon Child Care Resources, and we cover Baker, Mount Here, and Wallowa counties, so the whole east coast of Oregon from top to bottom, and I'm the director.
Thank you, Teresa. Welcome. And Virginia, would you like to introduce yourself?
Good morning, everyone. My name is Virginia Garcia, pronouns she, hers, ella. I'm also at Latino Network as the Early Childhood Workforce Development Manager. And so my role is to support staff with workforce and with professional development. So thank you.
Thank you. Welcome, Virginia. Mercedes?
Everybody, Mercedes Elizalde, I use she and her pronouns, and I am the Director of Advocacy at Latino Network.
Perfect. Thank you. Welcome. And Jen?
Hello, everybody. I'm Jen. I use she, her pronouns, and I'm representing Southern Oregon University. I actually hold many roles. Grant navigator is one. I also am a master's student. I'm a teacher's assistant at SOU, and also in the field, I'm a lead preschool teacher. So I wear many hats.
So thank you, Jen, for being here. About Jeannie?
Hello, everyone. I'm Jeannie Tafoya. I'm the Early Childhood Program Manager at Adelante Mujeres, and I support all of our programming, early ed, workforce development grants, and early initiatives for early childhood. And we are in Forest Grove as our headquarters, but we're also in Washington County, Hillsborough area.
Okay, thank you. Welcome. Now, Jada?
Are we just introducing ourselves? I was sent to, okay. I'm Jada Pierce. I work for the Black Parent Initiative in Portland. I'm currently the program manager for the home visitation program, parent education, and also the infant and early childhood mental health consultant program manager.
Thank you, Jada. Welcome. How about Mina?
Good morning, everybody. My name is Mina Smith. I'm a senior manager for early care education with Early Learning Multnomah Hub. So we are doing more of the convening for the system building and the policy advocacy.
Thank you, Mina. And welcome. And how about Letty?
Hi, good morning. Mi nombre es Leticia. Um, well, I used try to speak English. My English not so good, but I'm the child provider in Clackamas, Sandy, Oregon, in Clackamas, and well, I'm here used to listen and learn what I need to. It's my purpose right now.
Okay. Thank you, Lucita. Bienvenida. Leticia, bienvenida.
Gracias.
So did we introduce everybody? Seems like it. Okay, so my first question will be, were you able to read the previously sent materials? Everybody, yes. If you didn't, I can give you some 10 minutes to do so. So if you read it, can you do a thumbs up? And if not, I will give you some time to read it. Okay, so we may continue, or does anybody?
Can I get access to the document just because I'm having trouble finding it? Thank you.
Oh, let me see if this is. I will put it on the chat.
Thank you.
Here we go. Let me know if you can see it. Yes, okay. And would you like the 10 minutes to review it? No? Yes? If you already saw it, you can have a 10-minute break and other people can review it. Do we want to take those 10 minutes? Yes, okay. Well, let's do the 10 minutes. And since this morning we're going to be talking about competencies, and let me see, where's the competencies classification and registry. Please during these 20 minutes, please refer to the document on starting on page 20 and read that part, okay? So anybody that read it can go take a break and then be back at 10:39. Thank you.
Viviana, I think Crystal joined later.
Okay.
Oh,
Hi,
Jennifer.
Hi, Jennifer. Would you like to we're taking a break now, a 20-minute break. I'm gonna give you some time to introduce yourself when we come back. Do you have I just put on the chat link to the materials that we were reading for today's session, and I'm giving time for everybody to read it. If you already read it, you can go take a break. If you want some time, we'll be back at 10:39.
Thank you.
Okay.
You said it started on page 20, slide 20?
Yeah, slide 20.
Thank you.
Mhm.
Viviana, tengo una pregunta.
Dígame, Leti.
Sí, mira, sé que hay otra segunda sección. ¿La segunda sección es también en inglés o va a ser en español?
La de la tarde.
Sí.
Es en inglés, pero yo le puedo apoyar como quiera, ¿ok?
Oh, ok, está bien, solamente quería, estaba asegurando porque hay posibilidades que en la tarde no pueda y ahorita sí puedo pues estar escuchando e interviniendo de hecho creo que yo ya participé en una sección que hubo hace unas semanas atrás en, ah, en un lugar escroto, algo así, donde
Ah,
como una iglesia, algo ahí,
ah.
no recuerdo el nombre específico, pero sí sé de qué se trata, ya leí un poquito.
Hola,
ah,
Leti, ¿le puedo aclarar un poquito?
sí,
No sé si se acuerda de mí, porque
sí,
nosotras
sí, sí,
organizamos el evento
sí,
en Raro.
sí, sí, yo me recuerdo de ti,
Ah, lo que
gracias.
sí, lo que estamos haciendo hoy es analizando más a profundo lo que salió de esos grupos de enfoque.
Oh, ok,
Entonces, Sergio, no sé si recibió un correo de Sergio, pero él mandó
sí,
las diapositivas que Viviana puso en el chat y am, estamos viendo un poco de lo que ya estudiaron las compañeras, el equipo de investigaciones. Habían leído muchos artículos, muchas otras investigaciones que ya se habían hecho, am, y también resumieron, según los diferentes grupos de enfoque que tuvieron, las necesidades, los retos, todo eso. Y lo que estamos haciendo hoy es analizando, según todo eso, ¿qué podemos hacer nosotras? Entonces, las preguntas que nos va a hacer Viviana son sobre eso, am, cómo es que nosotras podemos colaborar para mejorar este sistema o abordar este reto que se haya dicho. am, y qué tipo de colaboraciones necesitamos. Quizás estén en este cuarto, quizás estén en el grupo grande. Pero el punto de es como analizar lo que se encontró.
es, ok, está bien, muchísimas gracias por tu ayuda, solamente quería estar segura de que estoy en el correcto lado, pero sí,
Sí,
muchísimas gracias.
y creo que como proveedora y como empresaria, sí, am, es muy importante también oír su voz en esta parte.
Ok, perfecto.
Estar aquí de ti. Algunas de nosotras hablamos en español que estamos en este grupo, entonces podemos ver, y pues Viviana que está tomando notas es bilingüe también, entonces creo que
Sí. Gracias, Abigail, por ayudar a Leti. Ok, buenas, estamos aquí de vuelta para tener nuestra discusión. Oh, sorry, I'm speaking Spanish. Sorry, we're back here to have our discussion. I hope you were able to review the material. I'm going to start screen sharing so you can see the questions. See. Can everybody see them? Can you all see the questions?
Yes.
Okay. So we're going to have approximately 20 minutes per question. And I will let you know when we need to change to the next question. So first, let me see. I had Crystal and Jennifer who could introduce themselves, or maybe when they come back, they can introduce themselves. The first question that we're going to be discussing today is, what is the key role that you or your organization, institution, or program could undertake or continue to support the advancement of the system towards more equitable, responsive, and accessible practices to help improve the support and needs of the Oregon's early child education career workforce? Anybody would like to start? Let's see. What?
Yeah, I was typing the question real quick so I can relay it to my professor as well. Will we be getting these questions as well after?
Yes.
Oh, very nice.
You will also be able to see the recording as well.
Well, that's true. The recording, didn't think about that. Sorry, Monday morning, not functioning brain.
No worries. We will also send out a summary.
To answer the question, well, to touch on the question, not really answer it. Some things that we're doing at Southern Oregon University as far as the ECE program goes, we offer online services, and that helps it make it more accessible to people in different areas, such as rural locations. And we are working on getting all of our ECE online services. Well, we're working on getting it bilingual as far as the reading materials. We're still working on getting quality like textbooks and such. They're just not out there. That would be lovely to find. But as far as our materials and our Moodle programs, we have a translator that's working on getting everything translated. So our folks who think their higher level thinking is in Spanish, they can read it, understand it, and then still participate in their bilingual English skills. So that's one of the ways that we're working on that.
Thank you for sharing, Jen. Anybody else?
I can go. As far as child care resource and referral, we're always trying to make sure that all professional development is in all languages that we serve. I also personally am a HEC commissioner, so Higher Education Coordinating Commission. And through that work, the reason I'm on the HEC is because I personally am pushing for streamlining the higher education in ECE and making sure that degrees are transferring, and that we are really looking at competency-based learning at that higher education level, and possibly even awarding more for life experience, like awarding a higher education for life experience, or showing proficiency.
Thank you, Theresa. And as you can see, I am letting you see what I'm writing, and I'm just jotting down the main topics of what you're sharing. So if you notice that I missed something, please let me know. Anybody else would like to share?
I can share.
Okay.
Okay, so the key role that our organization takes at Adelante Mujeres to really create equity is really for our workforce. We work with the Latina community, and what we do is provide trainings that are not just bilingual, multicultural, but also culturally sustaining. And we also build internal capacity, and it's something we're kind of trying to build through grants, is really making sure that our supervisor, coaches, and mentors are being paid equitably, and that our teachers are looking for other pathways aside from teaching. The other thing we're also doing to advance equity is ensuring that infant toddler teachers are paid equitably. Oftentimes, preschool teachers are paid higher wages, and we feel that it's not really fair. And so we're really working to really trying to remove that gap that we've had. And then another thing I think we're doing that we're trying to build on is really building leaders within our own organization, but also helping new teachers and intern students through Metro Workforce PDX to come in and really gain some skills, and even helping them learn how to navigate the Oregon early learning systems using Oro. We have, people who graduated with an EC have never heard of Oro. People who have been working in private Montessori schools have never heard of Oro. Lots of experience. We really help them to navigate this system. And I think one way we can continue to support the advancement toward it is really to see, as we're trying to professionalize the field, what can we lose by adopting Oro? Because we know that it does take a lot of heart and different skills that aren't just based off trainings and degrees. We have a lot of people who have experience, and I know that there's other, colleges. I know a college in California who does credit for learning, and is there an opportunity to do that here in Oregon to provide a credit for life experience or credit for lived experience? So that's something I hope that we continue to do, not just here at Org, but for all people who are pursuing this field. Sorry, I spoke so fast.
Don't worry.
No, I love that you brought that up though, Jeannie, because that was a topic that we talked about in a Salem conference, was how some colleges have credit for prior learning or, personal experience, but they're not universal and they're not transferable. So you may get it at one university, but other universities don't acknowledge it. So, or you may get it at a community college, but then it's not transferable. So finding a way to make it universal and have it accepted with standards is crucial for having that work. So yeah, you're absolutely right. That's huge.
And it's a little challenging, because we are, we're Oregon right over California, and they're adopting a different credential model. So they've gone the complete opposite way of Oregon. And that's what I really love about Oregon. They really, although they are using Oro, they still are trying to include CBOs, and are still trying to really acknowledge the field. And so I think we have to continue to stay on this pathway and not imitate California.
Right. Thank you.
Mina has her hand up. So.
Oh, Mina, do you want to share something, Mina?
Yes. The three things when you talk about competency, I think we need to really define what competent teacher look like, because I think it will be different if you ask parents, if you ask teachers themselves, do you feel skilled? Do you feel competent? And then of course, historically it is education credentials. So I think it needs to be defined, because otherwise it's only like one dimension of evaluation of competency, but it's really not seeing the whole, or it's defined as an white centric quote unquote competency, and it does not really serve the family having the competent teacher as a partner. So I think that's one that I feel like as a hub we can convene and discuss, with the parents, with the teacher, different groups, and talk and then define what competent teacher means. And also that if leveling up in a sense, wanted to make sure that's not just linear achievement, because there are so many ways that can become skillful, competent, knowledgeable, and that wanted to make sure there's so not just one way, but there are many other ways to achieve the higher level of competency. And wanted to make sure that the system itself is not punitive, in the sense that often government funding and the rules become very gatekeeping, very punitive to avoid the fraud. But in reality, that is far less than, I don't know what the rule makers think. That a lot of teachers don't want to make mistakes, don't want to, getting overpaid, and I interact with, providers and the teachers themselves, that they tend to under evaluate themselves, so that I'd rather the system is written in a way that it really trust based, rather than traditional, I would say traditional, the system, how, it's designed the hierarchies so that it's more equitable.
Thank you, Mina. Anybody else wants to share or would like to add to what's been said?
I think one thing that, well, I don't know if it needs to go here though, but we need to be, I really liked what you were saying, Nina, and also talking about not going toward California's model, because theirs is more like CSPC here in Oregon, like the teacher standards and practices for K-12, and there's a whole lot of equity issues with that. And I've seen a lot with, Preschool Promise and some of the other funding sources coming out, that if we keep standardizing all of this, that we're leaving a lot of people out who we say we want to be part of it, which is also what has happened with higher education, so to speak, is it has kept a lot of people out who should be there and should be able to show their competencies and earn recognition for it.
Thank you, Teresa.
I love what you just said, Teresa. Sorry, I was like, absolutely, girl, absolutely. And I'm like, oh, I'm mouthing that, and you're probably, what is she saying? I was absolutely. At that same conference in Salem, I met some folks from Clackamas, their community college, and they actually have an ECE program that's in Spanish. And I was like, tell me more. Tell me more, Dawn. Tell me more. I want to know more. How did you do it? How can we do it? How can we do more of that? Because it's just amazing. It is incredible. And I got goosebumps just talking to her because it's successful and it caused a ripple. And not just the ECE program was successful, but then it caused like welding and other pathways to open up because of it. So it's the need is out there and we're just not fulfilling it. So we need to step up our game. So that's why I was like, "Ah, you said it." So thank you for saying that.
I would love for Jeannie to talk more about that. If you are open to it, Jeannie, because I know that it was a collaboration with Adelante Mujeres that Clackamas Community College was able to do it.
Yeah, we've had two of our teachers graduated from the first graduating class in 20, I guess it would have been in 2022, 2022, I believe. And out of four. And so now we have more of our teachers who are doing the Clackamas partnership for teachers who speak in Spanish. And two of those teachers are now at Western Oregon since they're offering the BA. It's kind of in a bilingual model with materials in Spanish. So now what we found was because it was offered in Spanish, it really took away that barrier. So instead of having people like take all of these English classes ahead of time, people who are highly skilled and knowledgeable and have lots of experience by removing that barrier, they were able to get through school. And it was really interesting to see them say, well, now I can take an English class because I feel like more confident. And then the two teachers that are now in the BA program were like so excited just because we just see the more that you remove barriers, the more that you're opening doors and welcoming people. And so like, yeah, we're so proud of them, but also like, that is, if we didn't ask for it, it wouldn't have been there. So, we got to keep on asking and keep on finding creative ways to include everyone.
I love that Forest Grove helped Clackamas. That is amazing. You know what I mean? But it's like everybody's so interconnected. It's not, just you're on your own over there, you're on your own over there. We're all interconnected. And that's how we're going to move forward in this is when we all help each other. Oh, I love it. I love it. I love it.
And PCC is also offering a bilingual model for teachers, but we have seen most of our first generation, second generation Latina teachers who are more comfortable with that model. So kind of looking to see how we can support the different teachers here.
Mina, you raised your hand.
Yes. What was I gonna say? Okay, so within a competency, I would like to see like the special ed track. In a way, I mean, of course, everybody should have an inclusive practice, but as the state rolled out the no suspension expulsion, and then teachers felt not prepared to take care of the children with high needs, to integrate it to the typical preschool or toddler settings. And I think that we need to create the robust training session and special ed, and then just like public school teachers have special ed endorsement, specialized license, that if that's their passions, they can really pursue and become competent in special education and early ed.
Leticia, you had a question? ¿Tiene una pregunta, un comentario?
Es comentario. Me encanta escuchar todo lo que están diciendo, colaborando las otras compañeras. Perdón. En mi caso, como es es un centro certificado pequeño y estoy empezando, estoy familiarizándome con todos los requirements, los requisitos que piden. De hecho, actualmente tengo una compañera que me está apoyando y como alguien ya mencionó, es una buena trabajadora y para estar completando con los requisitos que pide lo de la licencia, necesita ciertos entrenamientos y horas de entrenamientos para cumplir con los requisitos, ¿verdad? Pero lo que estoy dándome cuenta es de que sí hay lugares donde proveen entrenamientos, hay que buscarlos, hay en español, hay recursos. Hay, como dicen, Oro ofrece recursos, los colegios ofrecen recursos de clases y son bilingües y esto está fantástico. El problema es, o que me estoy presentando, que la persona, a pesar de que tiene muchas habilidades para apoyarme, no cuenta con las habilidades como en la tecnología, por decir, no sabe cómo utilizar, abrir un Zoom, entrar a hacerlo del link y ha perdido muchas clases por esa razón y se me hace un poquito difícil porque si yo estoy con ella, yo le puedo apoyar, pero cuando las clases son en la tarde o en otro tiempo, no lo puede manejar ella, le hace falta mucha entrenamiento. Entonces es un poquito como frustrante porque hay apoyo en la comunidad, pero necesita como alguien más específico que apoye en esos detalles. No sé, no sé si es mucho pedir o mucho, ah, o si existe nada más que no he encontrado a alguien que se apoye para las personas que no tienen un nivel alto de, de, también de educación, porque hay personas que aparte que no tienen el idioma, pues la educación es muy baja.
Gracias, Leticia. So I'll summarize a little bit what Leticia was saying. She was saying that there are many resources, classes, bilingual classes, and the like to help uh, educators get on this path. And she's starting a small center, private center, and she has someone that can really help her. Is a great candidate to work with her in her early childhood center, but she could use some more help with technology. Sometimes when things are in the afternoons and there's through Zoom or the like, she doesn't have that. So more support also is desired to help people, not just in the language, but also in technology to access this information. Okay.
Same, girl, same. Computers are no bueno.
Okay, well,
Sí.
we're
Sorry, can I add something, Viviana? I think it came up in the findings in the professional learning section, like what Letty is talking about, like this importance on digital literacy. And I think for folks, and especially immigrant communities, digital literacy, language access, and I think, right, like varied educational experience across the board really needs like intentional support and partnership. I think we at Latino Network are doing some work with Free Geek around digital literacy, but it's not enough. Like it's not going to fill the need that we have. I work with about 42 Latina women in our early learning department, and there it has been humbling to just recognize because of people's different experiences. Many people didn't grow up with like computers and technology, and I think now during the pandemic we struggled a lot. We faced a lot of challenges, and we've been learning a lot. But I think there's still so much more room to learn and to grow. And I think, like what happened with the Clackamas Community College and Adelante Mujeres partnership, like what came out of that was really beautiful. And I think it just requires so much partnership for us to continue doing that. And it's hard to prioritize it when we have all this other stuff, all these other deadlines. But I think because like we're in a really unique position to like make these recommendations to the legislature and to the Department of Early Learning and Care, like it makes sense to ask for that. Like we need capacity to be able to build out these things. We need funding to be able to like dedicate time to build out these things, and to create intentional partnership with one another. I think we can, like, there are ways that folks have done it without those resources, and I think I think we could dedicate more resources to that. And so, yeah, I think I just wanted to add that piece around like, I'm thinking what Mina shared and some other folks around like the competencies, like it would make sense like for us to like come together and like and do that, or if something already exists, like we don't have to start from scratch, but like holding at the center, like language accessibility and cultural sustainability. Jeannie, you said something really lovely. I can't remember it, but yeah, I think anywho, that's where my brain is at. I'll pause.
Okay, thank you everybody for sharing. I see that Jeannie shared something with Leticia on the chat. Leticia, go check it
Yeah,
out.
I can say in English. We did create a digital literacy class for our EC teachers through a grant through Needles Us. And we do have digital literacy classes for the community. But this new training for early childhood teachers, is an internal one, but I'm wondering if like in the future, if we can have one for ECE teachers, for the, and provide it for more people. We have like 20 Chromebooks right now, so that limits our capacity of how many students we can have. But I'm wondering if like anybody wants to partner in the future. And I'm messaging our adult education teacher to see like, hey, who can take this training? So if they can create that for more educators, it'd be great.
Thank you, Jeannie. Okay, so we're now going to go to our next question. But keep those thoughts in mind if you would like to share in the end. We will have some time to review. What are the key partners or collaborations that you or your organization, institution, program will need to help advance this work? You have mentioned some things. What else would you like to talk about?
I'm gonna put you on the spot, Jen, just because I know that this is like core to what you do. Sorry, Jennifer Scheib, not Jen Hall. You are welcome to at any point though, Jen Hall, chime in. But just because I know that you didn't get a chance to introduce yourself, Jen, and I would love for you to be able to do that.
Thanks. Appreciate you. Do you want me to just introduce myself? Is that what you're wanting? Both and answer the question? I was thinking about the question. My name is Jennifer, she, her. I have a background in early childhood education for about almost 20 years. I worked at the Native American Youth and Family Center for 6 years in their early childhood program. I worked at Early Head Start. And now I work at Portland State University in the early childhood mental health field placement program within the School of Social Work. So I place advanced year, generalist year, and BSW students in early childhood mental health settings. And that might be prevention work in like community-based organizations. Like right now we have students at NAEA as well as Impact Northwest and Barbie's Village through Future Generations Collaborative. Anywho, that's what I'm doing right now. Sorry, I was thinking about this when you called me out.
That's all right. And if you need more time, go for it.
Yeah, give me a minute. Let me formulate all my thoughts. I was typing as I was reading to like get my brain going. So give me a second.
Anybody else would like to chime in while Jennifer thinks about it? what are the key partners or collaborations that you or your organization would need to help advance this work?
I think we kind of touched on it prior, didn't we, when we were saying we kind of need each other? I mean, those are the key, excuse me, partners that we need is communicating with each other and not gatekeeping any of the information. So Jeannie was saying that she has that great computer literacy class that could be beneficial. I mean, that's amazing, but how do we get that amazing tool and distribute it further and get it out there? It's we got to communicate with each other and find ways. That's the hard part.
So Jennifer raised her hand.
I have some thoughts. I think a big piece is funding. I think that is a huge part of the limitations that we have is that we don't have the bigger like institutional supports to support staff taking their lived experiences and their, you know, family knowledge or community knowledge and putting it into an education if there's not access to grants or stipends or just student loans in general. I mean, student loans are not the answer. Yeah, that is one big thought. And I think shifting the societal lens of early childhood education and early childhood life experience. I think it is like a largely marginalized group of humans, little people, children in general, and there's not a big enough institutional view that how young children are treated and experience the world will directly impact their health outcomes and generational health outcomes. And I think there needs to be more of an investment, not just in education, but as well as like medical. So that would be, I think that's what it's asking. It's my thoughts.
What Mina raised her hand.
Yes, I think it would be great to have collaborate or getting training from the some training institution for the DEI or rulemaking groups. Yeah. I forgot the other one, so I'll come back later.
Okay, thank you, Mina. So what are other organizations that you would like to collaborate? I saw in the previous question we talked about Adelante Mujeres collaborating with Clackamas Community College. Are there any people you would like to collaborate with, even, you know, if we had everything we want?
Actually, I think we also need to be working more collaboratively with Oro and changing the practices there and how they are recognizing training in general, and really giving preference to training hours, so to speak. I don't even know if we want to call it that because I think it all needs to be completely redone, but in things that change practices like working with other teachers on things, collaborating, coaching, those kinds of things, giving, credit for that versus a sit and get 1 or 2 hour training on something that isn't going to help anyone, but it got them their CKC.
Jeannie raised her hand.
Hello, sorry. Yeah, another thing I think would be to also collaborate with oral to ensure that they are kind of welcoming to new master trainers and really bringing those on so we can have more trainings with different lenses provided. I think that will, an oral, just a training on how to navigate oral with the cultural sustaining lens, all of these things I think would really expand training opportunities and maybe remove some barriers. We have coached and supported some of our leaders internally to get that master trainer, whatever that is, master trainer permit training, whatever it is. And so I think if they can just kind of help people navigate that process or really understand it or make it easier, that will be helpful to Oro as well.
I think we've too have noticed, and Virginia can probably speak more to it, but just the delays with oral processing. It came out in the research as well, how people have waited 3 months for their step to be updated, and the they prioritize like center-based or they prioritize centers, and for community-based organizations, I think it just kind of like leaves us out in the cold a bit. And so I would love to find a way that is less tedious and more in partnership for us to kind of like as employers, like could we like what permissions could we have to see information and to like update information? Yeah.
Yeah, I can echo a little bit more on what Abigail was mentioning. Um, yeah, so our staff, they didn't know what Aura was. I think that was something new for them, as well as understanding how to create accounts. Really, technology was a barrier. I think having a better collaboration with Oro to understand a little bit more of their work. We found some barriers that since we are, as Latino Network, we're not licensed, the training that staff are uploading their certificates take longer. And it discourages staff because they go into their account like, oh, it's already been 2 weeks, 3 weeks. Why haven't they reviewed my things? And so we have run into that barrier where it's like, oh, we're prioritizing people who, their license needs to be renewed. And so it doesn't seem like the system is very welcoming and kind of really more out there in the community because they didn't know what Aura was until I kind of like, hey, this is this system in early childhood that we're using in Oregon. So I think there needs to be some accommodations. I think something that I would love to see on my end as a sponsor organization at Latino Network is having access to our staff accounts, their Oro accounts, to be able to kind of see like, what are the trainings that you're needing to move up. And I think yeah, I can go on, but I think Oro needs to have like a more revamp system that is more accessible and even the website, I know it can be translated, but even videos like YouTube videos are just taking more time to understand the system, even when it's already difficult enough, even as an English learner, like speaking person. Um, yeah, I think I don't know. There's a lot of things I feel like, but the biggest one is collaborating with Oro, making some changes for it to be a more friendly system as well as more equitable. Oops.
So there's some messages on the chat. Let's see. Jen says, the Department of Learning and Care keep reaching out to community members to find out what they need rather than us giving them what we think they want. And engage with tribal organizations such as Confederate Tribes of Oregon and rural-focused organizations to ensure that remote and tribal childcare providers are included in workforce development initiatives. I'm going to include it here. Thank you, Jen. Okay. We have a few more minutes on this topic. Anything else you would like to share or throw out there as a possibility for collaboration or something you really desire? Even if there's no funding, but it would be nice to have.
Viviana, yo tengo un comentario.
Sí, dígame, Leticia.
De las personas que están trabajando en DELC o relacionadas a lo de cuidado de niños con la licencia, veo, porque yo empecé a hacer todo este proceso de involucrarme pues con lo de cuidado de niños en Multnomah, pero cuando ya me pasé a Clacama la organización es totalmente se debería de ser igual, pero he notado que hay muchas diferencias y no hay tanto apoyo como lo recibí en Monoma. ¿Es ustedes saben si hay algo o manera de cómo hacerlo link, que estén juntos o por qué hay tanta diferencia de condado en condado?
So, what Leticia is saying that when she started trying to work with her licensing through the Department of Learning and Care, she started with the Multnomah County, and then she received a lot of support. But then when she changed to Clackamas, it was different and less support than she had received in Multnomah County. And she was wondering if anybody if there's a way to make those two counties work together or share information or the like, or make this process more united, I guess.
Leti, ¿estás diciendo que los requisitos del condado eran diferentes? Sé que mencionaste que el apoyo era diferente, pero también los
Sí.
requisitos para empezar tu negocio.
No, los requisitos son igual, todo es igual el apoyo que recibí. Siento que no están, no hay la misma oportunidades de apoyo de que alguien te oriente. Yo sé que hay una guía y sé que puedo leer la guía, pero no es lo mismo que yo tenga a alguien que me esté apoyando 100%. A todo el proceso. A eso me refiero, porque ya ves que están hablando de cómo apoyar a las personas bilingües, dándole recursos y todo. No hay 100% alguien que se especifique ahorita para dar esa información.
Okay, thank you, Abigail, for asking that clarification question. So Abigail asked Leticia if she was talking about how the requirements are different in Multnomah County or Clackamas County, or if it's just the support. And Leticia was mentioning the requirements are the same, but the support is different. In Clackamas County, she gets less support. She can have, she can read the guide of what's needed, but it's not the same as having someone guiding you through it each step. And there's it seems like there's nobody that has that responsibility.
Leti, te puedo hacer una pregunta más. I'm so sorry. La pregunta es si
Sí.
¿sabes de dónde te estaban apoyando cuando estabas en el condado de Multnomah?
Sí, me estaban apoyando con las personas que están enfocadas a lo de la licencia, específicamente Amalia. y no recuerdo la otra persona que me ayudaba, que me daban como, estos son los entrenamientos que necesitas, esto es lo que tienes que hacer, sigue este link para agarrar este entrenamiento, ve a esta universidad, o sea, me daban como la guía más específica, como un asesor para mí, y en Clackamas no hay eso, o no lo he encontrado.
Okay, and so Abigail asked Leticia if she remembers she was working with at Multnomah and helping her out, and Leticia said that it was people who were focused on the licensing, and there was a person there called Amalia that was helping her, letting her know which were the prerequisites, what she needed to do, which universities gave this information. And so it was like an assessor that will help her out, and there's none on Clackamas, or she hasn't found that person yet. And I think her general question is, do you know of such a person?
I was going to mention, I think what Letty's mentioning is the CCNR support that she received in Multnomah County was is different than what she's receiving in Clackamas County. That one-on-one support for looking for trainings, all the pieces that she needs for her childcare. So I think es lo que estoy escuchando, Leti, que el apoyo que recibías en Multnomah County de Amalia, que te apoyaba con los entrenamientos, es diferente con el condado que ahorita estás en Clackamas, que no es igual el mismo apoyo en buscar entrenamientos en esa guianza.
Sí, así ese es el punto y, pues no quiero entrar en controversia, solamente quiero saber, porque si es lo mismo, necesito un asesor. Técnicamente ese es mi punto, porque si yo estoy batallando, no quieres imaginar cómo está batallando la otra persona que quiere lograr estar en las 30 horas para poder estar bien con la licencia.
Ya, porque cada condado tiene esa misma organización de recursos y referencia, el contrato que lo dan del estado. So, el rol de ellos de cada condado es ese apoyo a las que apoyan los niños, las cuidadoras. Entonces, yo me imagino que el trabajo debería de ser igual en cada condado, pero tal vez es diferente por organizaciones. So, tal vez ese apoyo en buscar quién para dar ese apoyo que usted necesita en el condado de Clackamas.
Ok, perfecto, muchas gracias.
Teddy, bueno, tú estás hablando sobre tu especialista de licencia que te apoyaba más. Sería la de CCLD, ¿no?
Sí, sí, yo tengo una especialista.
De ella estás hablando que Amalia era la que te apoyaba más. Because that would be
Antes,
CCLD.
sí, antes Amelia es
Oh,
Amelia.
okay. Okay. I was trying to understand if it was like licensing or like CCNR. So it'll be CCLD.
Okay, thank you, everybody. Now we're going to move to the next question. What are key resources that you or your organization, institution, or program will need to help advance this work? I'm sorry, Leticia was talking about the help she got at Multnomah County, and so she shared the resources that she will need. Anybody else?
I think speaking to what folks have shared, just clarity. I think it came up in focus groups that like people don't know what Oro is, the difference, like what CCRNRs do, that they exist. What Jeannie mentioned, CCLD, just kind of like what are all the different components in supporting our workforce. And also funding. I know we've talked about it already, but funding and intentional partnership. I think like funding that is tied to partnership. Like we can't do this alone. And I think having that be clear at the beginning to just kind of like incentivize and motivate us because this is how we need to do it. And I appreciate what somebody shared around like parent voice and like also how are we centering parents and centering children. Yeah, so some things.
There's some things here on the chat I'm seeing now. Oh, no, that's another from Nelda.
Yeah, I'm wondering, sorry guys, just been listening for a bit, but how would you like to see that clarity? Abigail, for example, would you like to see how does that look like a training, like a document, like how do you actually see it? What do we need to do?
I think yes, like all of it. I think what came to mind was like a video, like like the really cute like animated videos where they're like, so you want to like work in early learning. And I know I'm saying this in English, but like who are the people that you can go to for support, right? Like, and I have like a vision in my head of like these are the people, and like, oh, and if this comes up, then you can come over here, right? Like something really clear and like fun and engaging, but also written down for those of us that need something written, and a training for those of us that need somebody to sit down or to come and tell us like that way. I think, yeah, I think all of the different learning styles is important.
Thank you.
Mina raised her hand.
Yes, I really love that Abigail's idea of really meeting the different learning styles, but also wanted to make sure there are languages translated and as many languages as possible so that all the marginalized community keep getting marginalized and give teachers opportunity to learn in their own language.
Thank you, Mina. Jeannie raised her hand.
Yeah, I think collaboration between Delk and all these other entities within Delk, like CCLD and Oral, them really taking a lead on doing that media presence about, removing that barrier, whether it's through social media campaigns for people to understand Oral, to create a pathway for early childhood educators, or, really bringing on the future educators. We know there's a lot of high school students who are on that EC route in their high schools who are already taking all those trainings. How are they collaborating with community colleges, for universities to really understand it's not just like all the theory, it's really like the practical things of just getting overall, just navigating a system. And so I think there's kind of a disconnect between that. We see it all the time with a lot of people who come in here without, they had no idea what oral was and they have a degree. And so it's so interesting to see that disconnect. So seeing it really like pull from Delk and the other entities within them to remove that barrier. I feel like there is funding there for this. Gotta be.
Thank you, Jeannie. Jennifer share on the chat. Early childhood work benefits all facets of society, having investments from folks, not just early childhood education work. Example, health share and Care Oregon benefits from early childhood prevention work, even if they can't bill until it is intervention and billable. Institutional cross collaboration is vital. Thank you, Jennifer. And do you have an idea, following how Nelda followed up on Abigail's comment? Do you have an idea of what are some resources that we will need to make that happen?
I think what was just said before, like identifying folks who are already doing early childhood education from high school, because that's where my first introduction to early childhood education was at a Head Start classroom in Alaska. And I did that as a service learning project because I was failing out of high school. And they saw that I had an interest in early childhood education. I took a child development class, and then it put me to where I'm at now, which I ended up getting my early childhood education degree at PCC. Um, and then in my 30s, I got my bachelor's and master's with a focus on children and families. So it is this big circular process, and investment in community. But I feel like getting investment from outside of just the early childhood education field, that it benefits workforce development in all areas if children are supported and cared for. It helps people go to work if there's childcare and prevention services. So yeah, I think it's policies and programming as well as funding.
Thank you, Jennifer. Mina raised her hand. Let me see.
Yes. I think there need to be incentive to move up in competency. And also when I think about Maslow's hierarchy, teachers needs to feel like their life is secure in order to have the executive learnings. So wanted to make sure that the teachers are well compensated from the beginning.
Okay. Thank you, Mina. And what does your organization will need to help advance that? Mina, can you think of any key resources that your organization will need to help advance teachers' acceptable earnings?
I really love Jennifer's idea of not only depending on the public funding, but really have the private business component in once they learn that when the children are taking care of, the workers are more productive so that they can invest in early childhood. I think that's another resource that we can tap into.
Thank you, Mina. Jen shared in the chat, we can look for tools and resources provided by state-level advocacy groups like the Children's Institute, Early Childhood Education Advocates, and maybe Oregon's NACI. Anybody would like to comment on that?
Can I add it to my funding to be sustainable,
Yeah.
not just one time?
So a multi-year collaboration with funding. Hmm. And what key resources would, these questions for everybody, would your organization need to make this, to make these collaborations that you've talked about happen? We're talking about collaborations between the Department of Learning and Care and many entities, getting funding from private institutions. What does your organization need to make?
Yes, it just same. It just wanted to add that those funding needs to be sustainable.
Anybody else has an idea on how their organization, which resources will they need?
I think opportunities to connect with others would be, I think, the best resource, opportunities to have those moments to connect. Sometimes we get so busy with day-to-day lives that, we're busy surviving that we don't have the opportunities to connect with other resources such as like Clackamas Community College. I didn't have that opportunity before to know what they were even doing. So Jennifer says in the chat, using data to support the importance of ECE and prevention services that will support long-term economic improvement and positive health outcomes.
Let me add that here.
Oh, and then I also want to add it to that, the data and information from other states who have been successful so that we can learn from them and see how we can make it work for Oregon.
Thank you. Let me add what's in the chat. Jeannie, you mentioned on the chat, I forgot to mention create clear pathway to transfer international degrees and the ability to transfer provisional recognition. That's for one of our previous questions.
Yes, sorry, there's so much.
Okay. Oh, I'll add a note here. Okay. So Jen, you mentioned opportunities to connect with others. Would that be like having someone gather you all, like in the convention center or the like, where you can
Yes.
learn about each other?
Just like this. I mean, this is a great opportunity. Last week in Salem, Delk had the gas summit and consortium meetings, just little opportunities like this where we can gather together from across the state, different entities that we can share ideas and connect, talk about our needs. It's excellent idea.
Thank you. Thank you, Jen. If nobody else has anything to add to this topic, we could move to the next one.
I think in regards to connecting with people, there needs to be like common language used in those spaces because I think a lot of people are doing like similar things but using different language in their organization. So if we have like common language from like the top down, like whatever organization is kind of leading a initiative or whatever the case might be, I think that allows um, the people who are doing the work and putting it into action better understanding of what's being asked of them, where they're what the future looks like for the initiative and things like that.
Thank you, Jada. So yeah, so having a common language where, well, like you said, if somebody says you need pears, then somebody doesn't say you need apples. Like uh, you both need fruit, but use the same language. Okay. Okay, so we could move to the next question.
Viviana, Letty put something in the chat. She said, like scholarship support, for early childhood, that is barely starting up. So I'm thinking centers that are barely starting, that a lot of the organizations that offer grants, ask for 2 years in order to qualify.
Okay. Thank you, Abigail. Okay, so Leticia, se refiere a becas para los niños ir a la... Sorry, I'm confused. ¿A qué tipo de beca se refiere?
Mira, ahorita que ya estoy en este mundo de cuidado de niños, he mirado que hay muchas ayudas o becas para proveedores de educación y yo he intentado calificar, bueno, he intentado meter mi aplicación, pero no califico ni para School for All ni School Promise porque necesito tener 2 años en esto. Entonces, estoy apenas iniciando, los gastos son masivos y los clientes son muy pocos, entonces es muy difícil como salir adelante sin la dificultad económica, ¿me entiendes? Entonces ando como pidiendo apoyo ah, para poder mantener esto abierto y que siga adelante. Entonces, por eso me refería de que muchas veces el apoyo están para cuidado de niños ya establecidos que ya tienen más de 2 años, pero el principio es difícil.
Okay. Gracias, Leticia. So Leticia is saying that there are scholarships and financial support for people who work in early childhood education, but it's usually for organizations that have been doing it. The organizations that give these grants or scholarships want the applicant to have 2 years working in this field already to be able to qualify, and it will be very helpful if it people who are new could access them, because in the beginning there's a lot of costs and very few clients. So having that support early on would be helpful. Okay, so we can move now to the next question. What policies or changes to policy would you need to help you make these changes happen? The changes we've been talking about.
I think we need like commitment from, I think we've talked about like Delk, but other potential partners, like to commit to this work and to like partnership in how there's going to be alignment among competencies, and steps and trainings and all of those things. Because I think that is what's coming up is that there's not enough alignment and we need those different entities to like include that in their policy.
Jeannie has a raised hand.
Yeah, as they're creating alignment, especially more language around like P through three alignment that I keep hearing about, ensuring that they also include culturally based organizations who do a lot of the direct service work. I think that's really important. So as you change policy, ensuring that everyone is included at the table, especially those in private family childcare and all kinds of different delivery models, it's really important to include us all, since we're the ones who will be working with children and families directly.
Thank you, Jeannie. Anybody else? Or add on to what's been said?
Maybe I know it always comes back to funding, funding that's going to fall from the sky, but maybe targeted funding, specifically. I know we have the grant through DELC with the pathway certificate through the cohort, but maybe like a targeted funding program for specific, like if we took, for example, the computer programming, class, maybe if we could have more specific funding targeted towards that computer literacy and other languages to get them that basic need, that basic skill that can launch them into other areas and make them successful. Building the foundation, that could be helpful. It would be very helpful. And that's kind of a policy.
Thank you, Jen. How would Abigail, I'm gonna ask you a question. How would a more commitment from the ELK and other partners will look like?
I think that Delk has mentioned that the outcomes of this report and out of like the findings, that the recommendations, that they're gonna make space for the recommendations in their like strategic plan or their plan for like the next so and so years. If I'm misnaming something, please share. I might say this. But I know that they've like said this, and I think I just want to make sure that it is like written out somewhere for that accountability piece. And for clarity's sake, right? And I think if we are committed to alignment around competencies and classification and registry things, I think starting at that like policy level or like written level is a good place to start, because it ensures we have receipts.
Abigail, I've been thinking about a way to say this, I think for like as this question came on, because I do think it's both a policy and an attitude shift where instead of seeing this as kind of a, early childhood is like a sea of vendors and a sea of separate organizations that exist in the community, for Delk to see itself as the leader of a system that engages in early childhood education, right? Because if they see us as like vendors and individual organizations that they have oversight of, there's less obligation to do things like being the responsible party on saying what are the shared standards and how are all universities expected to change their training or curriculum to match those so that no matter where anyone goes to school, they get the same education, right? Like if Delk or the state broadly doesn't see it as their role, then it'll continue to be lots of separate things. And so I think part of it is a policy shift in seeing itself as the builder of this network of early childhood programs and services, including the workforce element, and not just overseeing individual organizations.
Thank you, Mercedes. So if I got your idea correctly, you want them to start seeing themselves as the people who create this system of early childhood education and care, and they give the guidelines on how to do it so it's unified instead of just having all the different types of providers, and they're just like seeing what's out there and um what's the word you use? um Overlooking them.
Yeah. And like the difference between saying all community colleges and four-year universities should have an early childhood program, right? That's like you as overseeing that work in the community, but seeing it as separate, versus saying, here are the things that are required, or that everyone who's going through any early childhood program in any formal education should know that they're getting, and those credits should transfer because they should be the same, right? It's a more active role than just kind of putting it out there. Here's what we think standards should look like, and all of you do your best to meet them, as opposed to saying, there's going to be some sort of entity that says what those standards are and how we're meeting them, like leading us in that work. And whether that ultimately is Delk or is something different, somebody has to be the owner of those standards if we're going to achieve a space where they are analogous, and someone moving from one employer to another employer has easily analogous experience in education that can be accounted for. Otherwise, we are just kind of staying too separate, and we're not able to necessarily say that we're all meeting the same standards. We can all say we're working towards the same standards, but if we don't have kind of a third party entity that is helping us set those goals very clearly, then I think we're going to continue to see, a university be like, well, our program is just a little bit different, and so we can't take those credits. Or, as an employer, our, credit for prior experience, this is how we grade it. And so you may or may not get credit if you're transferring jobs, right? That it has to be something that lives outside of us as individuals if we're really making that easy for the worker.
I have two raised hands here. Abigail and Jeannie, do you know which one raised their hands first?
Abigail, you can go first.
Okay. I think I was trying to like make sense of what I was thinking, as I think Jen was sharing how like she hadn't heard about like the work being done at Clackamas Community College until the Grand Articulation Summit, and like this like want and need for people to come together. I've been part of like communities of practice and like people share out, but it can really quickly like die down because it doesn't feel like there's like a shared goal. And so I think if there's like a shared goal, like reasons for us to continue to come together, I think it'll keep the momentum and keep the investment on all of our parts. And, you know, when we're having the conversation around competencies of like, it should be like a partnership, like creating what those competencies are, or like what have you, I think it also made me like, I would love to be a part of that, but I need somebody to lead it. Like, you know, and I think right now what Mark said is what you shared around like tasking Delk with like with like with the convening of like these of the important like why we're getting together, like what the goal is, and allowing us to like truly work in partnership, I think is kind of it marries like what I was struggling to like figure out in my head, like what would that look like. And so I appreciate that. So I just wanted to share that.
Thank you, Abigail. And Jeannie, what would you like to share?
I think just that commitment for me would also be just like simple language around the commitment it is to educators, from coming just from the state and knowing that, you know, there is a need for children to have high quality programming, and what high quality looks like and is defined is obviously different for everyone, but we know that for teachers, like it's not just having that degree, it's a support for mental health services. And you know, just having wraparound support all around, whether it's recognizing the field, recognizing them as professionals, or recognizing that they are, you know, during COVID, they were the essential workers, right? And so I think just a promise, a commitment to educators and to supporting the workforce long term and being able to invest in it long term. I would love to see that kind of language in the simplest form possible for educators so that people are excited to join the field and people can trust that this field is something that is sustainable for themselves. Because right now, I don't think that a lot of people, you know, choose ECE as a long-term career. And I would love for that to happen for people so that we can have continuity of care for children, so that we can provide the best early childhood system for families and children with this new lens that includes all of the voices. And so I think language like that kind of commitment, that Oregon is going to hold on to, you know, the true needs of children, the true needs of families, of our communities, and of our teachers. I would love to see that in writing somehow. The rest is all logistical, it's all funding, but just seeing them commit to that and be held accountable to that and say, remember, you said that you were going to put teachers first. So what does that look like? What does that mean long term for all of our teachers? All with all the different backgrounds that they have and all the different pathways that they take.
Thank you, Jeannie. I see I have Jennifer is sharing, if there are rigid requirements and or there is an increase in education requirements for early childhood educators, then there needs to be funding set aside to offset the costs of said requirements for early childhood educators, which might be reallocating parts of state funding and other funding pools. There also needs more accessible pathways to higher education. Thank you, Jennifer. Oops. We have a few more minutes on this question. Anything you would like to add or comment on? Well, we can move to the next one. What are the key policy recommendations you have for DELC and policymakers to help you make these changes happen? I think you have expressed some of these ideas. What recommendations you have for DELC and the policymakers? Mercedes had mentioned having someone, a third party that would be in charge of making the, sorry, I'm losing my words, to be the ones in the leaders to make this happen instead of just overseeing you all doing your work, but having someone take the lead on defining what early childhood education looks like and how it works and how it's funded in Oregon. What are other key policy recommendations you have for DELC and the policymakers?
It sounds like there needs to be like a whole body of work and funding associated with updating and improving the ORO system, like just that tool by itself. We had a whole bunch of comments in here about things that need to be changed. And so there would need to be some kind of project launched specifically to reform and update that system.
Thank you, Mercedes. What are the recommendations? What would you like to see happen?
I think for what I heard was something similar for experience-based competencies and not just hours or training.
Gracias. Thank you, Abigail.
I heard also sustainable, like consistent funding, which I think is really important to think about in terms of also setting those standards. Like if we're going to have stable, consistent standards, it has to be met with stable, consistent funding. Because if we try to do standards without the funding, we're going to find why are we not able to meet all of these standards, right? And yeah, that those things really go together. The less consistency and stability and funding we have, realistically, the less we're going to be able to meet broad, consistent standards across different programs because everybody has to keep working with what they can find rather than us like setting both a quality and a funding standard together.
Thank you, Mercedes. I see there's some things in the chat. Jen Hall said, ensure multilingual and culturally relevant communication, community outreach fund, and train community liaisons from underserved and marginalized communities who can serve as trusted connectors between families and early childhood education programs, providing personalized communication and support. Thank you, Jen. And Jennifer said, prioritizing funding for early childhood work and workers, looking at the bigger impacts of not having high quality early childhood education spaces. Jeannie, you have your hand raised? Or is that from before?
Yes. Sorry. I think for them to really ask themselves and analyze where is the EC workforce today and where do they want to see it in 10 years? They can start with 5 to 10 years. And what is that to map it out for a 10-year at least? To have a vision for that, I think would be great for policy recommendations because I know we work a lot within grant limitations or year to year. So I would love for them to create a vision for it. Like, as the population increases, as the population changes in Oregon, what does that mean to really support our workforce in all different types of capacities? Lived experience, how do you integrate actual, degrees, international degrees? What does that look like? I'd love to see a plan for that.
Thank you, Jeannie. There's something else here in the chat. Jen shares, create advisory councils, committees within early learning departments that include representatives from marginalized communities. These councils could advise on policies, communication strategies, and the design of programs to ensure they reflect the needs and perspectives of the communities they serve. Thank you, Jen.
That echoes what someone mentioned earlier, is just getting more of, what the community wants. It's just maybe if they created like a committee that could meet and advise, that would be beneficial, perhaps.
From the communities being served. So something like what we're doing today with you, with all of you, but with the families.
Can I add to that idea, Jen? I think we do something similar with our early learning hub and early learning Multnomah. We have a parent accountability council. I think that is, I don't know if it is required for all early learning hubs. But I think if it is meant to advise the Department of Early Learning and Care directly, I think having some guidelines for like what that intentional like commitment and partnership with families looks like and like how people will be compensated for their time and energy, but also like what having really clear what will be done with like what their advice like is, like I think it's one thing to just be like, oh yeah, like there's a group of parents that meet that advise us, like check, and then just kind of move on and continue business as usual. But like for them to actually have some like decision making power, or like sharing that decision making power, I think would be really important.
So, Abigail, in your programs, you have something called Parent Accountability Council, where you learn from the parents what they need. But you don't know if this is something that other organizations have.
It's for the Early Learning Hub in Multnomah. The state has, I think, one for every county. And in Multnomah, where we have families, they partner with us to make sure that parents are at the table and like are informed of like reminders and like those things, right? Like setting parents up for success to be engaged. I think that they do something similar in other areas outside of our county. I don't know if it's required. Um,
Okay.
yeah, so like we're involved like in partnership with Early Learning Multnomah, but it's not like ours. We just like support parents in getting there.
Oh, okay. Jeannie added, develop an Oregon Early Childhood Education Workforce Committee with paid early childhood education educators, practitioners, representatives, CBOs, higher learning, DELC, family advocates, mental health professionals, workforce development experts, and parent leaders. Okay. Put it here. Thank you, Jeannie. Do you want to add to that or? Okay. Okay, so in the recommendations so far we have there needs to be a body of work to update and improve the oral system. We have throughout the discussion, we have seen that there's a lot of barriers to work with it. We see seeing finding policy to make sure how we address crediting experience-based competencies and not just hours trained. Sustainable, consistent funding to be met with the standards. So each organization is not just working on what they have, but that everybody can meet the standards because they have funding. So it's consistent throughout the state. Ensure multilingual, culturally relevant communication, community outreach fund, and train community liaisons from underserved and marginalized communities who can serve as trusted connectors between families and early childhood education programs, providing personalized communication and support. So kind of making sure that families are connected with the early childhood education centers in a way that is culturally responsive. Prioritizing funding for early childhood work and workers, looking at the bigger impacts of not having high quality early childhood education spaces. Kind of seeing the big picture, what we'll see in the future if we don't have this. We would like to see a plan of how we want this field to move forward in the next 5 to 10 years. See how it looks like now and where we want it in 5 to 10 years. Create advisory councils, committees within early learning departments that include representatives from marginalized communities, which goes together with the idea of sharing the decision-making power with communities. And develop an Oregon Early Childhood Education Workforce Committee with paid EC educators, practitioners, representatives, CBOs, higher learning, DELC, family advocates, mental health professionals, and workforce development experts and parent leaders. Is there anything you would like to add? And did I miss something that any of you said? Okay, well, I think we can go back to the main room. Don't leave the meeting. Just leave the the breakout room. Thank you all for being here and sharing your ideas and being open to talk with us.
Thank you, everybody. It was so fun.
Thank you.
Gracias, nos vemos.
Okay, let's go.
Do I get back?
Yeah, let's see. I'm trying to figure out if I can send you back or if you need to choose that. Let me see. Hmm. Do any of you see a button on how to go back to the main room? Oh, leave room.
Okay, thank you. Just wanted to let you know, yeah, the afternoon session's happening at 2, and welcome to come back. Just let us know. I am gonna just reach out to everybody. Sergio, if you can just keep your group. Did you bring them back? Sorry. Okay. So I'll just wait then and do both of you together. I'll just wait a little bit. Sergio, can you let me know when everybody's here from your group?
From my group, we're all here.
Okay, perfect. Thank you so much. Uh, Excellent. So I was saying, I just want to spend a couple minutes. I'll close you out first. The other groups are still going on. So I want to tell you the meeting at 2 p.m. where we will look at the next topics of conversation. And those are, professional learning, higher education, and career pathways. You're welcome to join if you want to. We'll go from 2 to 4:30. And for those of you that are not coming back, just thank you very, very much for your support today. We are going to compile and summarize what was discussed today in a document that will be live and shareable to you if you want to contribute, spend some time in there. We appreciate that. If you want to add anything by next week, October 28th, we'll circulate that on Wednesday for you so you can have some time if you decide to do it. The Delk staff will have an opportunity to review that and add also any thoughts. So there's like similarly thinking of some of the things that they need to think about. Before all of that, we put it together and in the final study report. I'm gonna a reminder that we will compile the meeting of today, like both the sessions, and those will be in the website that belongs to Delk. And you should be hearing from Fifth Element, Ami, and Akasha about the stipends for these sessions. And so, the pre-reading, the sessions that you participated in, and then if you are able to provide feedback, that's also counted as a stipend. Um, yeah, we want to make sure if there are any questions, anything that you would like to add or comment on. Um, how are you living if you're not coming back? Anything else?
Just thank you for the lovely facilitation and the time allocated to have those small group conversations.
Oh, thank you, Dana. Anything you want to share, or also with your peers in your group? Anything you wanted to share and maybe didn't have time because you had to come back? Okay. Well, I have a few names in here of people that but we just need a little bit of information because they we didn't have their emails. So let me see if there's anybody from this group. No. So I think we're good to go. Thank you so very much again. You have a lovely afternoon, lovely lunch. See you later.
Thank you.
Bye.
Bye.
Thanks so much,
Bye-bye.
everyone. Thank you.
Okay. Sergio and Kim, if you want to take just a break, and we'll come back. How was it for you?
My group was a little on the quiet side, but we got some, I think, surfaced some good ideas and certainly I don't know, commiseration, validation for.
Okay, so I was reminding everybody of circulating the draft and for you to have the opportunity to review, and also make sure that you know that that will be a similar exercise, that this is a public meeting that will go on the website, the DALK's website, and that you should hear from the element from Amy or from Akasha about the stipend for this, and so you will have you know, for whatever it is that you did for pre-work, the session, AM or PM, and also the work that you can do to review. And Melissa's group, I will repeat this for you when I'm done. I'm almost done with the other group. So, yeah, thank you so much, Viviana's group. Is there anything else you wanna add or share? Anything to your teammates? Any final thoughts? Anything, anything to recognize and anything else before we wrap you up and let you go? Well, we will see some of you later on in the afternoon. So I appreciate that. And we just need to, if Crystal and Jennifer can stay a moment. I think Paulina needs a little bit of information from you because we want to make sure that we have your emails and positions so we can circulate the document appropriately. The document and then the study results. If you can, I don't know, Paulina, can you chat with them? Yeah, excellent. Thank you so much. Okay, well, thank you, Viviana's group. I think most are gone. Thank you, Viviana. You, uh, we can see you later, so you can take a good break. Yes. Okay. Gracias. Bye. Okay. And Melissa's group is back. Everybody's here.
Oh, I think some of them, most people have already left.
Oh,
Heard that
okay.
as a, yeah.
Okay. Yeah, no, it was like yeah, but I'll let you know who we need to did Marcella left? Yeah, we had
Marcella
some
left earlier, yeah.
and Leora. Yeah,
Leora.
we just need we needed their information. So yeah. Okay. So we'll let the rest go. Thank you so much. We'll see some of you at 2 p.m. from 2 to 4:30. And you will hear from Fifth Element around, like I said, the stipends, way to see draft of the summary of today. And a lot of appreciation. Anything else you want to share before we let you go? Thank you. Thank you so much, Jennifer. Thank you, everybody. Thank you, Abigail, Mercedes, Cristal. Okay. See you in the afternoon.